Hello and welcome to Respect Victoria's COVID-19 and the Primary Prevention of Family Violence in Victoria online forum. I'm Carla Grant and I'm a proud Western Arrernte woman, and I'm also the host, journalist and executive producer of Living Black on NITV and SBS Television, and I'm honoured to be your MC for today's online forum. And before we begin, I'd like to acknowledge the traditional owners of the land I'm on today, the land of the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and future. And I also pay my respects to the custodians of the lands wherever you may be joining us from today. Over 200 people have registered for this seminar, affirming the need for this research into how COVID-19 is implicated in the prevention of violence. This research is only possible because of the people who agreed to be interviewed. Our sincere thanks to them. Respect Victoria is an independent statutory authority focused on the primary prevention of family violence for all Victorians. That means stopping violence before it starts by changing the culture that allows it to happen. Amy Prendergast is the acting CEO of Respect Victoria, and Cecilia Hermana is the director of the Research and Evaluation Unit. And this represents the first in a series of research forums releasing reports of projects developed specifically by Respect Victoria and addressing the primary prevention of family violence and violence against women. The Gender and Disaster Pod is an initiative of Women's Health in the North, Women's Health Goulburn North East and Monash University Disaster Resilience Initiative, MUDRI. The GAD Pod has worked in gender and disaster since the Black Saturday bushfires in 2009. The Centre for Family Research and Evaluation is an applied research centre located within Drummond Street Services. CFRE undertakes applied research, evaluation and capacity building activities within Drummond Street Services and externally through consultancy services. CFRE is driven by social justice values and prioritises work with and for marginalised communities, including LGBTIQ+ people. We will be using the Q&A feature today on this platform, so we will be taking questions after each topic. So please post your questions in the Q&A box, not the chat window. We also encourage you to use the chat window to share any thoughts or reflections during the presentations. We'd also like you to complete the online survey at the end of the forum. So this live stream forum also has Auslan interpreters, and we have Sarah Kennewell and Gabrielle Curley joining us today. And now to get things started, I'd like to call upon Wurundjeri Elder Tony Garvey to welcome us to country.
Thank you very much for that very warm welcome, Carlag. And I'd just like to start off saying Wurundjeri to everyone. So Wurundjeri in Wurundjeri language means welcome. So welcome to all Indigenous and non-Indigenous people here today. Also, I'd just like to say that I'm very proud and honoured to be opening your event, and also very proud and honoured to be representing my people, the Wurundjeri people, Wurrung. The Wurundjeri people are a part of the Kulin Nation. So Kulin means man. So in the Kulin Nation, there were 5 language groups. There was the Wadawurrung to the west, Coorong, who were the westerly neighbours to the Wadawurrung, Tanarong to the northeast, Bunurong to the southwest, and the Wurrung of the Wurundjeri territory that we stand on here today. The Wurundjeri lies of inner cities of Melbourne. It extends from the mountains of the Great Dividing Range, south to the Yarra River, west to the Werribee River, and east to Mount Borbor. The Wurundjeri people, they have a social totem. It is Bunjil the eagle. Bunjil represents spiritual powers throughout many parts of Australia. Bunjil taught all the laws about life, behaviour and ceremonies to make sure that our culture could continue for all walks of life throughout Australia. Bunjil is referred to as the creator of mankind. Bunjil created great people from the land, and that is why we call the land our mother, or the mother of creation. Never can the land be taken away. The land will always belong to Aboriginal people, as we are part of the land and the land is part of us. Our story is similar to yours. Yours is by your chosen faith, ours is by the dream time. We both have creators and beliefs, and ours is Bunjil. It is a traditional custom of the Australian Aboriginal communities to be asked and to give permission for people to enter their land. And today you have now joined with me to honour the spirits of my ancestors, past, present and emerging, who have been around this land for over 60,000 years. And we as the custodians of the land offer you a heartily welcome to the land and hope that together as citizens of this beautiful country, we can build, develop and unite stronger nations for all people. I'd just like to finally close in my Wurrung language, which is Wamidjika, Wandun, Wurundjeri, Balak, Yemen, Kumbibik, which means you're the most welcome to the land of the Wurundjeri people. Thank you very much for having me here today.
Thank you so much for that, Tony, for that lovely welcome this morning, and it's great to hear language being spoken as well. And now I'd like to welcome Amy Prendergast to say a few words.
I must be.
Sorry, and I'd just like to add also that Amy Prendergast is the acting CEO of Respect Victoria and is an experienced social policy executive with strategic leadership at both state and national levels of government. She has played key policy and coordination roles under the National Plan to reduce violence against women and their children, the development of Victoria's primary prevention of family violence strategy, and the establishment of Respect Victoria as an independent statutory authority. Please welcome Amy.
Thank you, Carla. Thank you, Tony, and welcome to everybody. Really great to see so many people here today. I'd like to begin by acknowledging the traditional owners of the lands on which we all meet and pay my respects to elders past, present and future. And particularly in the context of the primary prevention of family violence work, to acknowledge the real leading efforts in prevention of family violence work in Aboriginal communities. Most notably, the whole of community efforts to bring together women, men, children and elders in this space, of which we have much to learn. I'd also like to acknowledge those who've lost their lives to family violence and to victim survivors wherever they may be, and for those that continue to suffer as a result of that violence, either from themselves or their loved ones. Our work at Respect Victoria in primary prevention is dedicated to victim survivors. And we'll just move on to the next slide. Today's a really important day as it marks the first in Respect Victoria's new research series forum, Building the Evidence to Stop Violence Before It Starts. And it's really great to see people from a range of sectors here today and organisations. As you all know, and some of you may not, we are an independent organisation dedicated to the primary prevention of family violence, and our focus is on stopping violence before it starts. And I'll talk a little bit about that shortly. Just before we go on to the next slide, today's seminar will introduce you to 3 key pieces of research focused on the COVID-19 pandemic in Victoria. And this research was conducted by Respect Victoria in partnership with the Gender and Disaster Pod and Women's Health in the North, the Centre for Family Research and Evaluation at Drummond Street Services and the National Ageing and Research Institute. And the rapid research being presented today forms part of an overarching strategic approach developed by Respect Victoria at the onset of the pandemic. And this is really in line with our legislative remit. Essentially, we're interested in building evidence-based primary prevention work and being able to share that with governments and organisations to support them in their work. So then if we go to the drivers of violence, just to let people know, we're really driven by evidence in our work. So including our Watch Has Changed the Story, we know that there's particular drivers we need to address in terms of preventing violence against women. In preventing violence against women, we know that there's 4 particular manifestations of gender inequality that we need to look at, and they are on the screen there, but they're condoning or minimising of violence against women. We need to address men's control of decision-making and limits to women's independence. We need to address rigid gendered roles and stereotypes in society, and also male relations that emphasise aggression and disrespect towards women. If we're trying to address family violence and violence against women, we also need to look at the intersecting factors. So in addition to looking at the drivers around gender inequality, this is talking about things like racism, ableism, ageism, and heterosexism and other forms of discrimination. Briefly, for those of you, if we can just skip over to the next one, for those of you who are newer to primary prevention, at Respect Victoria, like other prevention and social and behavioural change initiatives, we're really focused on stopping the harm before it starts. So if you think of road safety or skin cancer reduction, etc., we're really focused on that in family violence prevention. So we want to stop the harm before it occurs. It's a long-term approach that works by identifying the underlying causes or drivers of violence, including those mentioned on the previous slide. It's distinct from secondary or tertiary prevention, otherwise known as early intervention or response. And those elements kind of focus on preventing the violence from reoccurring or escalating, but we're talking about where the violence hasn't actually started. But of course, primary prevention works best by supporting early intervention and response, so that over time it reduces the overall prevalence and demand for those services. And we know that primary prevention is the only way in which to sort of end that violence over time. So over to the next slide. So looking at the prevention of family violence in a disaster management context, what do we know? And many of us may know this instinctively, but what we do know is that the coronavirus pandemic, like other disasters, has exacerbated structural discrimination. So what this means is that the factors that put people at higher risk of COVID-19 and its economic and social fallout are the same factors that put people at heightened risk of family violence. This means that while the pandemic has impacted all, there's a disproportionate impact on people, and some of the statistics here by Gender Equality Victoria start to illustrate this. What we have seen over 2020, beginning in 2020, is a huge surge in demand for family violence response services. And Victoria is now facing its highest reported crisis of family violence in history, with a 9.4% increase to police reports in 2020. And these are, of course, incredible statistics coming off the back of a Royal Commission and the #1 law and order issue that was already called out. And that's worrying for people. The other thing is to note that anecdotally, we know that more bystander activity is occurring. So that's more police, more neighbours and friends calling up police when they're worried about family members or people in their community, and that's a good thing. And possibly there's also increased faith in reporting to systems, which is something that we need to continue to monitor as we move out of the response and into recovery. Regardless, Victoria is not unique, and there's been an increase of family violence worldwide from the start of the pandemic. And we know, of course, that this doesn't exist in a vacuum. Violence isn't occurring because people are at home or they have money stresses, but that it exists in the context of inequality, discrimination and marginalisation. And without intervention, violence is more likely to increase, not just in the immediate context of the disaster, but over the medium to long term. And that's something we really need to get a grip on in terms of a policy response. We just flick over now. So in response to the pandemic and in response to what was emerging, Respect Victoria in early 2020 convened a group of family violence response and prevention specialists to share information about what was happening on the ground and the impact of the pandemic on those drivers of violence. And together we focus specifically on how primary prevention can be incorporated into a disaster management cycle. So not just to consider in response, but also in mitigation, in recovery, and in preparedness. And specifically, we concerned ourselves with the ways in which discrimination increases the risk of family violence and violence against women in disaster. And we undertook analysis with our sector partners in the particular discriminations exacerbated by COVID and what was required from a policy, planning and emergency management point of view. And from this, we developed an advocacy resource taking an intersectional approach to the drivers of violence, which we published online, and I encourage you all to have a look at. Intersectionality is, of course, the key to understanding how multiple and overlapping forms of power and privilege create discriminations, in the orange, that you can see in the wheel here, which underpin coercion and control. And disasters like COVID-19 exacerbate those elements in the dark orange, the structural discriminations, and less specific actions are taken that are relevant to those individual needs in the light orange. To the next slide. It is this model that informed our decision to conduct rapid research into the impact of the pandemic on specific populations, beginning with older Victorians and LGBTIQ+ people, in addition to the impact on the primary prevention workforce itself. We must recognise as well, though, that the pandemic has had a significant impact on people from migrant and refugee communities, Aboriginal people, people with disabilities and people living in rural and regional areas, and there's much more work to be done in this space. To the last slide. So before we begin our first session, I'll just say in closing that for primary prevention of family violence, violence against women to be successful, it must be addressed by the whole community. And so we're really delighted that there's a huge variety of people here today to listen to the research and evidence and think about how it applies to your work. In addition to family violence practitioners, of course, police, emergency services, health, justice, education, government and community sector can help avoid or reduce the impact of discrimination exacerbated under disaster for people, and therefore help prevent family violence. So as you listen to the research today, I'd ask you to keep in mind that while disasters upend our society, they also have the potential to disrupt in positive ways. And I'd ask you to consider the role your organisation can take in helping us build back better. In the context of a disaster, one of the most important things that we can do is to ensure greater diversity of representation and leadership. We can also promote women's financial security and encourage men to take up unpaid labour and care work. We can embed self-determination and cultural safety in the disaster cycle. And we can ensure people with disabilities have better access to services and assistive technologies, particularly in those moments of crisis and disaster. And we can ensure messaging from government and from media doesn't position certain groups as burdened or passive victims of disaster, but includes them in decision making. And we can ensure that when we broaden our support for families to include rainbow families specifically in our messaging. And finally, we can ensure we resource community groups effectively to advise on direct support for migrant communities and those most at risk, including women on temporary visas in our community. And these are just some of the ways in which we can build back better as a society after the pandemic and together help prevent family violence. Thank you.
Thank you very much. I too would like to acknowledge the traditional custodians of the land that I'm located on today. That's the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging. And I'd like to say thank you to Carla for that introduction. What I'll be doing today is I'll be introducing you to the literature review that was part of, or the desktop review that was part of the project, COVID-19 LGBTIQ+ family violence prevention, which I'm going to call Prevention in the Pandemic. The project was funded by Respect Victoria, and the lead agency was Drummond Street Services in partnership with the GADPOD. Beth McCann and her excellent research team led the project, and it was conducted through June to September last year, and I think you need to keep that in mind when you listen to all the research projects today. We're talking about the findings from June to September in 2020, and things have shifted since. And I won't be talking about or clearly addressing those shifts today. The aims of our project were to understand how COVID-19 and COVID-19 restrictions were impacting the lives of LGBTIQ+ Victorians, with a focus on the drivers and risk factors for family violence. I conducted the desktop review. Beth and her team did the interviews and wrote up the report, and we collectively wrote up a set of recommendations. The terms of reference for the literature review were to look at policy and resources addressing the impacts of COVID-19 on LGBTIQ plus people and the primary prevention of LGBTIQ plus family violence. And I was looking at materials produced by Australian and international LGBTIQ plus organisations, and also materials that were being put out by national and international legal and health bodies, particularly the United Nations and the World Health Organisations. I used a range of sources, academic publications, policy reports, and also media postings and blog postings. The search terms that I used were incredibly broad, and I put them down the bottom there. So there was a collection of LGBTIQ plus descriptors, some descriptors for family and intimate partner violence, and descriptors for emergency and for COVID-19. So what I want to do is I want to take you through, as I say, what I found out from the international review. In June to September last year, there was very little data coming out specifically around family violence, but in Australia, Equality Australia had done a national survey, and these are some of the results, preliminary results from that survey. So out of their over 2,500 respondents, 5.5% of LGBTIQ respondents reported currently living with someone they feared may be violent, abusive or controlling towards them. Of that 132 or 5.5% of people who reported being at risk of family violence, 29% lived with a spouse or partner, nearly 40% lived with their parents, with or without other family members, and 40% identified as trans or gender diverse. The survey by Equality Australia found that First Nations LGBTIQ plus people were overrepresented among respondents who reported they didn't feel safe at home. And a report done by AFAO at the same time found, and that's AFAO is the Australian Federation of AIDS Organisations, and they're based in New South Wales, but they're also a national body, or their research is national. They found that LGBTIQ plus young people and trans and gender diverse young people were overrepresented among those who feared or had experienced violence from someone they lived with during that opening phase or second phase of the COVID pandemic. When we looked at the international material, one of the large international LGBTIQ plus human rights organisation, Outright, did a quick and dirty, as they called it, survey, and they found that elevated risk of family and domestic violence was one of the 7 top issues identified by LGBTIQ plus people in 38 countries. ILGA, and they're the International Lesbian, Gay, Bisexual, Trans and Intersex Organisation, did a rapid assessment of the impacts of COVID-19 on LGBTIQ plus people in the European Union, and they too found that increases in family violence was identified as a major issue in 23 member countries. And I've just pulled out 2 stats from the ILGA report. In Montenegro, the lead LGBTIQ plus organisation working with victims of domestic violence reported a 300% increase in demand for support services, and similar increases were reported in France and in Italy. As Amy has pointed out, during pandemics, including COVID-19, we see an increase in structural inequalities and the impacts of structural inequalities, particularly on minority populations. So the first quote I have here is from a research group in New South Wales, who are probably the lead researchers on LGBTIQ plus impacts of disasters on LGBTIQ plus people. And they've said the marginalisation of LGBT people is heightened during disaster as existing inequalities are magnified. And early last year, the United Nations High Commissioner said LGBTI people may be particularly vulnerable during the COVID-19 crisis. Now, we know that regardless of crisis situations, that LGBTIQ plus people are subject to sexuality and gender diversity discrimination, which manifests as increased economic and social marginalisation and increased rates of violence and harassment. And we know in turn that these economic and social factors place LGBTIQ plus people at increased risk of a number of health and wellbeing issues, so mental health, drug and alcohol use, homelessness and family violence, to mention a few. It also reduces LGBTIQ plus people's access to essential and mainstream services. Again, as Amy has said, under COVID-19, we know that those existing structural inequalities are actually magnified and their effects. And that includes not only structural inequalities based on sexuality and gender diversity, but also structural inequalities based on gender, race, ability, age, and location. So for LGBTIQ plus people, this places them at even greater risk of economic and social marginalisation and prejudice-based violence and discrimination during and after COVID-19. And again, as Amy has said, these risk factors are further magnified for LGBTIQ, sorry, my language has changed, for LGBTIQ plus, that should say people who are part of other minority populations and subject to the intersections of multiple forms of structural inequality. So that includes LGBTIQ plus young people, older people, Aboriginal people. It includes sex workers. It includes LGBTIQ plus migrants and refugees, and LGBTIQ plus people with disability. So if we look at what came out of the LIT review, as I say, a quick and dirty LIT review, we found that under COVID-19, we did see increased economic and social marginalisation of LGBTIQ plus people. So according to Equality Australia, LGBTIQ plus people in Australia are overrepresented in sectors that were hardest hit by the COVID-19 restrictions, including education, retail, hospitality, tourism, and the creative arts. So they were subject to the impacts of that increasing economic marginalisation. Preliminary analysis of Equality Australia's national survey showed that during the first 2 months of the pandemic, LGBTIQ plus people, unemployment among LGBTIQ plus people rose from 7.5 to nearly 13%. Almost 1 in 3 of their respondents had lost significant income, and 1 in 5 LGBTIQ plus respondents had lost more than half or all their income. At the same time, the federal government's first raft of economic stimulus measures focused on male-dominated industries such as trade and construction, where women and LGBTIQ plus people were underrepresented. At the same time, at that period, the initial $1,500 for JobKeeper payments excluded casual workers with less than a year continuous employment, many of whom were young people, including LGBTIQ plus young people, and no consideration was given to providing financial assistance to LGBTIQ plus community and support agencies during the pandemic, many of which depend on limited government funding and part-time and volunteer labour. So you actually got a decrease in the sort of services that LGBTIQ plus people needed to access. At the same time, we saw increasing discrimination and prejudice against LGBTIQ plus people, and I've just pulled out a few examples. So there were a number of international reports documenting LGBTIQ plus human rights violations under COVID-19. So on the 17th of May last year, the UN reported, quote, "Some states have enacted measures which intentionally target LGBT persons under the guise of public health measures." And again, I've just plucked out 2 examples, but there are many more in that report. So the Hungarian government had used COVID-19 emergency powers to enact legislation preventing trans and gender diverse people from changing their birth certificates. And Poland had used similar emergency measures or emergency provisions under COVID-19 to enact what they call stop paedophile laws to stop sex education in schools, particularly removing safe sex and HIV material, with all the hidden assumptions that gay men are pedophiles. A number of countries have used the COVID-19 pandemic to ramp up and condone harassment and hate speech against LGBTIQ plus people. Some national governments and conservative political and religious leaders have scapegoated LGBTQA plus people, blaming them for the emergence or the spread of COVID-19. And the LGBT Foundation in the UK reported a 36% increase in calls reporting homophobic discrimination and a 70% increase in transphobic discrimination at really the emergence of the pandemic, that 16th of March to the 5th of April last year. What I thought I'd conclude by looking at some of the ways in which COVID-19 restrictions, which were meant to limit the spread of the virus, may actually reflect as they amplify these structural inequalities against LGBTIQ Again, I've got the wrong numbers there, LGBTIQ plus people. And I've done it under 5 categories. So I'm talking now specifically about the stay-at-home restrictions. I call the first one the trauma and the weight of history. The reporting of COVID-19, I think, reminded a lot of LGBTIQ plus people, particularly gay men my age and older, of the response to the HIV and AIDS epidemic. It was reported in very similar ways: quarantining, daily infection rates, daily death rates, discrimination and fear. And I think for some of us that actually triggers those memories of that time. For a number of queer, I'll just use queer here quickly as a shorthand, our relationship to police and public policing. We have a difficult history with police, and all of those public policing measures in public spaces, again, I think could re-traumatise LGBTIQ plus people. Many of us are very wary of public surveillance using apps and testing, given the history of institutional abuse. And in Victoria in particular, but Australia, COVID-19 was just adding to 5 years of public scrutiny and trauma of our communities. There was the Safe Schools, there was then the same-sex marriage, and then there was currently the Religious Discrimination Bill. And in one way, COVID was just the fourth. It was just the layering onto that already quite traumatic past 5 years. There were some disproportionate impacts on LGBTIQ plus people with social distancing measures. Initially last year, a lot of the definitions of bubbles and so on and closest kin really relied on heterosexist definitions of family and partner independence. For many LGBTIQ plus people, their access to social networks outside their homes are absolutely vital to their sense of well-being. And gay men have some very complex socio-sexual networks which were disrupted. When we look at supports, there was loss of LGBTIQ safe and affirming spaces. There was loss of community support. One of the key findings I know Beth will talk about when she looks at the actual interview data was, particularly among LGBTIQ plus young people, was having to return home because of economic pressures to hostile home environments that were homophobic or transphobic, environments they'd actually left to set up queer-friendly houses that now had to go back into. And of course, there was increased visibility and public harassment. There was lateral violence. We found that on online and social media platforms, certain LGBTIQ plus people were shaming other LGBTIQ plus people, issues around refusing to download the tracing app to get tested, people who were continuing to see regular partners, or sex workers who were continuing to see clients. And finally, there was issues around LGBTIQ plus sector capacity. As I said, there was a withdrawal of funds from community organisations, and there was a real drain on the LGBTIQ plus organisations that did maintain funding. And that will have longer term consequences for what happens after, whenever we actually come out of COVID, to make sure that the LGBTIQ plus sector capacity is rebuilt up. So what I'd like to say in conclusion is that what we know from that literature review is that there were increased reports of family violence, which suggests that there were increased rates of LGBTIQ plus family violence. The aims of this review were to look at the drivers and risk factors. I'd suggest that under COVID-19, the drivers have increased. That's economic and social marginalisation and harassment and discrimination. That's brought with it increased risk factors of a range of mental health issues. And I want to suggest that the COVID-19 restrictions have drawn on as they further increase those drivers and effects of structural discrimination. And that sets a background to argue that clearly with an increase in drivers and risk factors, that will explain, as I say, those opening stats showing that there have in fact been an increase of family violence or reporting of family violence against LGBTIQ plus people. So that's all from me, and it's over to Beth McCann.
Great, thank you, Leah. There you go, can you all see that? Yep. Okay, so Leah's given our project quite a good introduction, so I'll just go through this first section quite quickly. I'd like to begin firstly by acknowledging the traditional owners of the land on which I'm calling in from today. I'm sure we're all calling from different lands. I'm on the Wurundjeri land of the Kulin Nation, so right between the Darebin and Mary Creeks in beautiful Wurundjeri country. So I'd like to acknowledge elders past, present and emerging, and recognise and respect the land and the cultural significance of this land. So Liam's talked through the literature review and the scoping that we did as part of the project. We also did a number of focus groups and interviews. So in total, we spoke to 42 participants, which included 29 LGBTIQ community members and then 13 sector professionals who worked across a range of different services working with LGBTIQ people, both within sort of social services and specifically in family violence services as well. We had a specific engagement strategy to try and engage people who we knew were experiencing multiple forms of discrimination. So we tried to recruit Aboriginal and or Torres Strait Islander people, people of colour, people with a disability, sex workers, young people, because we knew young people were significantly impacted by the crisis, and people who were immunocompromised. In terms of what we found, I'll just go over the key findings now and then I'll talk through each of the individual risk factors and our key findings in more detail. So what we found was that there are some real structural inequalities and societal norms which encourage violence against LGBTIQ people. So not only do we see gendered norms playing out, but we see cisnormativity, heteronormativity, racism and ableism. So we've got that as our kind of norms within society. We've also got a lack of recognition and understanding of diverse sexuality and gender, of family diversity and of LGBTIQ family violence within society. So this fits as our kind of structural and organisational kind of level. And then we also found that there's some individual level risk factors if we look at it within a socio-ecological model. So we've had things play out, particularly during the pandemic, such as mental health, social isolation, relationship dynamics and changing power dynamics in relationships was something that we found within COVID, financial distress, lateral violence and community surveillance, barriers accessing services and coping and resilience. So in terms of the individual level risk factors now, I'm going to go through them and I'm going to give you some of the quotes that we heard from our community members that we interviewed, because I think it's really important that that shines through. So in terms of mental health, people were talking about not coping, mental health deteriorating across the board, increased anxiety, depression, stress. Some people spoke about the impact of their mental health of losing work or income and the impact that it had. There was increased anxiety around getting sick. There was isolation from friends, community, from LGBTIQ community in many cases. Many people felt really isolated from their families of choice. There was increased racism, there was unsupportive family members, a lack of support, and there was some past trauma coming up as well. So people found that this kind of cluster of different things that were happening during COVID was really impacting the mental health and the mental health of people around them. So one participant told us, basically everyone around me is struggling in some way or another, and it's very hard both to be coping with my own struggles, the struggles of my partner and the struggles of my friends. It seems like basically no one's okay right now, and I feel like it's quite exhausting from a mental health perspective. I think this mental health issue kind of shone through in all of the focus groups and interviews, and it was really well summed up in this quote. People also spoke about individual and relationship level risk factors. In individual relationship level risk factors, social isolation was a big one. So people felt really disconnected from friends, family, community, and this was a universal experience across COVID, particularly during the lockdowns. Some people spoke about living alone and the isolation that this brings. Others spoke about having recently immigrated or being new to an area and not having networks of support. Other young people spoke about having to move home and move away from their share house, their friends, their families of choice, and move back with unsupportive families of origin, which was really damaging in many cases. So a couple of quotes. We had an international student who said, "I've been here for 2 years now and I don't have a family here. So COVID has been extremely isolating for me in a way because I don't live with people and I don't connect with anybody. So for the past few months, it's been extremely isolating." People spoke as well about being isolated and not being able to go out and volunteer. One participant said, "Being stuck at home, it's been quite challenging. Because I live with my family and I'm not out to all my family members, it feels like I'm back in the closet. This was something we heard from a lot of LGBTIQ young people and a lot of service providers working with LGBTIQ young people. They really had to, when going back home, they really had to hide their identity and who they were. Economic impacts, as Liam spoke about a little bit in his wonderful introduction. So people spoke about a loss of employment, reduced working hours. They talked about this not only having an economic impact in terms of the money that they had and the financial stability, but also the loss of income for many created a bit of an existential crisis. What were they doing with their lives? Where were they going? They couldn't support themselves. So there was some questioning around the social impacts of loss of employment and working reduced hours within this context as well. So as one participant told us, I suppose there's an obvious one of where you live in whole households who are working in vulnerable sectors. So if you get a cluster of issues and if you have queer households where there's not family support, they're relying on everybody in the household to bring an income. And if you are all in vulnerable industries or sectors or whatever, then you have everything coming together. So this was something that Liam talked about in terms of a high number of LGBTQ people working in vulnerable sectors and many of them losing employment during the pandemic. So this had quite a big impact on people's lives. Relationships was a big one that people talked about, and it was kind of the crux of what we were getting at in many of the interviews and focus groups. So we wanted to know about people's relationships, domestic relationships, familial relationships, intimate partner relationships and caring relationships. We wanted to know how some of their relationships and relationship dynamics had changed during the crisis so that we could identify risk factors. So one participant told us it's just harder than ever to have a healthy relationship with people. Lots of young people told us that living at home with parents meant that they were really struggling at the moment and there's no relief from that. And this came from the sector professional. There's no school to go to or university or job to go to. Regardless of whether or not that's something they enjoy, it provides some relief and they're able to get away from complicated situations at home. People talked about strain on relationships, and I think we heard about all different types of relationships. So this was in terms of a family of origin. We heard a lot about relationships with intimate partners. One person said there's definitely stresses and boundaries and things like that, more arguing definitely. Although I'm grateful that I'm still working, there are stresses around that. I find that there's at least 2 extra hours that I'm doing that I would have been doing face-to-face, and that brings its own stresses in the house. Within this relationship thing, people also spoke about how if one partner had lost a job, who was traditionally the breadwinner in the household, this had changed fundamentally the way that their relationship worked within that setting. So there were a number of ways that relationship dynamics changed during the pandemic in relation to some of these broader factors. Accessing services. So people talked about limited services, particularly for for LGBTIQ, so queer and trans people was the quote for this one. There's often more limited service that they can access that are targeted at queer and trans people because of both previous experiences of anxiety around potential experiences of discrimination and stigma, and also actual experiences of discrimination and stigma for many people. Those are really well founded. Some people spoke about accessing services was made easier during the pandemic because of telehealth, which was a real positive that shone through. Others spoke about how telehealth actually put them at risk, having their sessions online and talking to a practitioner and not being able to have privacy or to escape their house to talk about that. So telehealth was a real mixed bag in terms of what we see. So one participant told us, I always felt like I was in my room with the door shut. I had the kids at home and they were homeschooling and I had people working from home. I still felt I didn't have a private space. It was like I was just on alert that someone might walk in right then. I wasn't as authentic and as engaged in therapy as what I normally am. We also heard from some young people who engaged in the research that they had to create code words with whoever they were talking to online because they actually did have parents or family members sitting at their door listening to their conversations. So there was a real risk for some people to engage in telehealth during the pandemic. Someone with a disability told us that I felt like being on the autism spectrum and that a phone option was really difficult for me to communicate and understand communication as well. I rely on being face-to-face to communicate properly. So some people just couldn't have that same engagement with telephone, and many of those people just dropped out of services altogether during the lockdowns. But then there were some positives. For me, it's actually the service provision by Zoom and teleconferencing and stuff. It's wonderful because of my sensory issues. If I had to go somewhere to do this, I actually would not have ever participated because it's really loud out there. So we kind of had that mixed bag. We also had people tell us that it was great because they could access LGBTIQ specific services without having to travel an hour or 2 hours to get to see their practitioner. So for some people, it made access a lot easier. In terms of service responses, people really talked about a need to find services, particularly during the pandemic when they had a range of issues going on. As one participant said, where you don't have to explain your queerness. I don't find that helpful. I find it's like I don't want to have to educate every person I'm talking to. So a lot of people really want LGBTIQ specific services that can support them where they're not having to explain who they are. Someone said, normally I see a psychologist who I travel for 3 hours return drive to see because that's the closest one I can access. A bonus was I didn't have to drive to see them, so I saved time on travel and the energy to do that, which I thought was absolutely great because they've never offered a Zoom option before. So in some ways, we've opened up a new way to deliver services to people, which hopefully will be ongoing. In terms of structural and system level factors and intersectional experience, this is something that really came up and it was something quite interesting, and it talked to the need to really understand family violence prevention using an intersectional lens. So people talked about racism, for example. One participant said, I'm Asian, so whenever I wear a face mask and go out, people are just staring at me with a kind of strange look. We heard this from a number of participants, particularly early on in COVID. Someone said, I've noticed an uptick in students that I've been dealing with in my work express racist abuse to me. Yeah, I feel like it's really unusual because it's not normally something that's part of my life at all. Someone said it might be because they're a young person, and authorities or adults are wondering why they're not at home doing the right thing. And I think it's a power differential there. And that if they're a person of colour, the world likes to really target people of colour doing any activity. So there was these, particularly from the sector, people had noticed that racism had increased during the pandemic, and this really impacts people in the way that they live their lives and the way that they feel comfortable to live their lives. Ableism was something that came up. So people with a disability talked about some structural issues that they faced. Some people spoke about the fact that Centrelink payments didn't increase for people with a disability, despite there being income support for other people. So income support for disability payments didn't actually increase. Despite that, people with a disability were at higher risk, often because they had to have carers coming into their home and they had a dependency on others to be COVID safe. One person said a population of people who are really significantly vulnerable and do not receive targeted health messaging, as no one was telling them specifically what they should be doing, and all of them almost exclusively use public transport, and they're expected just to continue going to work. Homophobia, biphobia and transphobia. So we found young people were particularly vulnerable to this during COVID, particularly young people who had to move home with family of origin. One person from the sector actually said to us, you need structure, you need cultural change, because I think especially for folk from LGBTIQ plus community, it's so assumed that any type of discrimination is normal, particularly within families of origin and particularly with young people, because young people are disempowered. That your parents know best, your parents have rights, your parents can control this. Sometimes it's really embedded in systematic and institutionalised systems. So this was something that came up, that there's a normalisation of homophobia, biphobia and transphobia within society. So I guess this takes us back to the risk factors in primary prevention. It's complicated. There are a number of individual risk factors which play out at the individual level and impact a person's ability and to cope with COVID and their resilience and the way that they have relationships and engage with society. We have that overpinned by heteronormativity, cisnormativity, gendered norms, racism and ableism. And it's these structural norms and structural inequalities which really impact the way that they experience all of the other individual risk factors and everything else that's going on. So I guess the takeaway from this research from us is that we really need to look at intersectional frameworks which look at addressing patriarchy. So within patriarchy, we have heteronormativity, cisnormativity, gender norms, racism and ableism, among other issues. It would be great to have primary prevention initiatives going forward, and I know that Respect Victoria has been already doing a lot of work in this space to look at how we can challenge not just gender norms and gender inequality, but a more holistic view of patriarchy and patriarchal inequality, which impacts people in different ways. And that's it. I think we'll take you over to Carla for some questions.
Thank you so much for that, Beth and Liam. That was just so interesting to hear. And I'd just like to invite people to remind people to send in your questions through the Q&A box, not the chat window. So if you do have any questions for Beth and Liam, please send them through. We'd love to hear from you. But I guess first of all, I might just ask you a question to start it off. I mean, we heard so much about the way the LGBTIQ plus community have been affected and impacted by the pandemic. Firstly, what are the long-term impacts of these issues to the LGBTIQ plus community?
Liam, did you want to take that one away?
I mean, that's one of those questions that raises two issues for me. One is, I think the impact on the LGBTIQ plus sector will be enormous potentially, because a lot of those organisations, as I said, run on the smell of an oily rag. They run on volunteer labour, part-time. They've been impacted and their capacity has decreased. And then if there aren't resources put in to build those back up, that could be a real issue for LGBTIQ plus young people. The other thing is, I know from the research Deb's done on the gendered impacts of disaster, that often the increased discrimination, the structural discrimination that ratchets up, has much longer term consequences. I don't know how that will be for the queer community, but I do know that under disaster conditions, there's often what I call discrimination on steroids. A lot of conservative people, a lot of people who are quite aggrieved, use that as an opportunity to air a whole set of grievances against the queer community. We saw that in the same-sex marriage debate, where suddenly people who've been holding these prejudices were given a forum to air them. And that's one of the worries about things like COVID, where particularly, not so much in Australia, but in other countries where you've seen a conservative backlash where they've been blaming LGBTIQ plus people again. Those can have just longer term consequences on the community as a whole. So they're just two very broad issues.
Mm-hmm. Beth, would you like to add anything to that?
Yeah, I was just going to say, I think the service provision one is a really interesting thing. So we've seen increased rates of family violence, we've seen increased mental health difficulties, we've seen financial distress. So there's a range of factors that do need to be addressed in terms of that longer term recovery. And I think we need to think about this with society more broadly. How do we recover from a pandemic where people have been severely impacted? And what does our service provision look like to ensure that we have great primary prevention messaging to reduce violence, but we also have response to a range of different factors which increase people's risk of experiencing family violence. So I think we need to think quite holistically about recovery from this pandemic and thinking about it as quite a long-term thing. It's not something that's instantly going to bounce back. We do need to actually put resources into dealing with some of the issues that have emerged.
Mm-hmm. So what is, I mean, we do talk about putting more resources in, but what is being done currently to improve the situation for this section of our community?
Well, there are a range of service providers who are offering services, but I think, you know, as Liam said, there are really long, they run off the smell of an oily rag. There are really long wait lists. So if you have to sit on a wait list for 7 months to access a service, there's a lot of things that can deteriorate within that 7-month time period. And I think particularly if we're looking at the kind of broader risk factors which lead to family violence, if you're not able to access the early intervention services or support with other issues, then it really can escalate, and it can escalate quite quickly if you've got a huge range of factors going on in your life.
Liam, would you like to add anything to that?
I do know in Victoria, perhaps which may or may not be unusual across the country, there has been increased investment in family violence services and also in LGBTIQ plus services, and that's continuing through COVID and post-COVID. So perhaps the situation here at a service level will be better around recovery, that queer people will have greater access to the services they need. I don't know if that's true, but I know that money is being put in a way that isn't true in other states and territories.
I guess, yeah, finally, I'm still waiting for some questions to come through. So please, people, send in your questions through the Q&A box. We'd love to hear from you. But yeah, I have one more question to ask you both. I guess, you know, are you both hopeful that things will improve, that we will see, obviously, as you've said from the research, there has been you know, an enormous increase in lateral violence, safety, withdrawal of funds to organisations. You know, there's been economic and social marginalisation. You know, the isolation, racism. You know, people's mental health are being impacted. Are you hopeful that, you know, that things will improve as we come out of the pandemic?
I think I'm always a little bit hopeful, so there's always an optimist in me that thinks that yes, I think things will get better, but it needs a concerted effort of everybody. So it's not going to get better on its own. There needs to be measures that we take and things that we do in order to improve the situation for people. We need to start having challenging situations about things which are embedded in our society and in our culture and in our norms. Like, it's not okay to discriminate against people based on their identity, and yet we continue to do it within society, at individual levels, at organisational levels, at structural levels. And I think that all of us need to question some of those norms within society and start challenging them and coming up against them. And I think if we do that, we really do have the opportunity to improve services for our most vulnerable and marginalised people within society.
Liam, one final comment from you.
I always take a different tack here. One of the things that strike me through the research is that a lot of groups whose own privilege has never been questioned, who've never experienced the anxiety or self-censorship that many of us who are part of minority groups as part of our everyday lives have experienced under COVID. And you can think about men and white middle-class men, straight men in that group, who have never experienced some of the everyday stresses and anxieties that face many of us, including Indigenous Australians, women, and LGBTIQ plus people. So one of the things I think there's an opening of a real shift is some of those groups who've never experienced that, who now have under COVID, who've experienced these low levels of anxiety as just part of their everyday life, they might actually understand the experience of minority and marginal people a little bit better. And I think there's a real issue around empathy in COVID and empathy in the response to disaster that opens up those possibilities. Whether they're taken up, I don't know. But I think one of the huge issues for minority groups is that often the majority just don't understand that. They don't understand that everyday discrimination is just woven into your very bones. And they've had a little bit of that experience during COVID. And if they could just open that up to say, I understand now that Indigenous Australians or women or queer people are subject to that every day. Oh my God, that's terrible. So I put a little bit of hope in that bundle, even though when I look at our politicians at the moment and I hear the way they talk about things, there's a complete withdrawal of empathy at the moment. But I think on the ground, there is a much greater understanding at the moment.
Well, let's hope that things do improve and there is greater understanding for our LGBTIQ plus community. Thank you both so much, Beth and Liam, for joining us this morning. It's great to have you with us.
Thanks, Carla.
Thank you.
So now I'd like to introduce Kate O'Halloran and Deb Parkinson, and they're going to be talking about impacts of COVID-19 pandemic on older people, a family violence prevention project. So Dr. Kate O'Halloran is a journalist and research fellow at the National Ageing Research Institute, and Dr. Deborah Parkinson is the manager of the Gender and Disaster Pod and an adjunct research fellow with Mudry. So I'd like to hand it over to Kate. Take it away.
Thanks for having me. All right, I'll just share my PowerPoint slides. Give me one sec. Sorry, I had too many tabs open, it looks like. All right, I'll get back to the beginning. Can you see that all right now?
Yes, we can. Thanks so much.
Great. Okay, yeah, so my presentation today is on elder abuse and disaster, and specifically the thematic literature review that was done as part of the project that was a collaboration between the National Ageing Research Institute, which I'm representing today, and Jigsaw Research. So Deb will speak to the second part of this project, which involved interviews after me. So as with Beth, I'd just like to start with an acknowledgement to country. So the National Ageing Research Institute acknowledges the Wurundjeri people of the Kulin Nation, the traditional owners of the land on which we meet, and pay our respects to First Nations elders past, present and emerging. So as I said, this was a collaborative project between Jigsaw Research and NARI, obviously as part of Respect Victoria's program that we've heard about today, entitled Elder Abuse and Disaster Prevention, Resilience and Recovery. So the role that I undertook was leading the thematic literature review, and again, this is time sensitive or specific. As Leah mentioned, this one was done in June, July last year, and it covered 4 key points. So the first was just older people in the context of disaster generally, how they fare compared to younger people, and then the specific issue of elder abuse in the context of disaster, and then what happened in the context of COVID-19, at least mid last year, in terms of how it may have increased both drivers and risk factors for elder abuse. And then we ran over a number of intersectional considerations, including the differential impacts on marginalised groups, such as older people from culturally and linguistically diverse backgrounds, older women and older LGBTIQ people, but I'm not going to be able to cover all that today because I've got only 10 minutes. All right, so first up, in terms of older people and disaster in general, we found that older people are overrepresented in death and injury tolls both during and after disaster. And some of those impacts include things like anxiety, stress, fear, a sense of helplessness about their own and their family's well-being. In the medium and long term, we found deteriorations in older people's physical health, including sleep disturbances, and they were also more likely than those under the age of 65 to report symptoms of post-traumatic stress disorder post-disaster. But it wasn't quite as simple as that. So older people showed significant resilience in the face of disaster. They're actually overrepresented in volunteering initiatives and recovery initiatives post-disaster. And it wasn't quite as simple as saying that someone's older age left them more vulnerable to the impacts of disaster, but it was more dependent on things like their functional capacity, capability, or impairments. So, for example, we found that risk of death and injury following disaster was much higher for those older people who were living in aged care facilities, who had multiple chronic conditions or disabilities, dementia and or cognitive impairments. And sadly, we also found that human rights violations were higher or increased in the context of disaster for older people. Just very briefly, some of the intersectional considerations that came up in the literature review were that women and people from minority ethnic backgrounds, I should say also Aboriginal and Torres Strait Islander people, were at elevated risk of death in most disaster situations. We also found that women showed higher proportions of post-traumatic stress disorder symptoms in the aftermath, But we did find some evidence for protective factors in the context of disaster. So they were things like existence of support networks for older people, and particularly intergenerational connections seemed to aid recovery, but also be protective in terms of post-traumatic stress disorder. And then in terms of our specific view of elder abuse in the context of disaster, it was really obvious that there was very limited evidence on this. So a systematic review from 2014 showed just 19 articles on this topic. And then at that point in June last year, there was just 2 more on this specific topic. And overwhelmingly, we had only anecdotal evidence of elder abuse during disaster. So there was only one, for example, quantitative source, which did show a 38% increase in reports of abuse and neglect in areas affected by major flooding in the US. But I found that quite striking that there was only that one quantitative academic source. The most evidence that was there, anecdotally and otherwise, was for financial abuse in the context of disaster. So there was evidence of things like contractor fraud. Victims were, interestingly, most often older white women with college degrees who were married. There were land tenure and documentation issues, so older people being considered squatters in certain countries if they couldn't produce documentation to prove that they owned their homes. Corruption, so older people being asked for money or favours in return for aid or relief. And older people were also underrepresented among aid recipients, even when programs targeted them specifically. There was evidence of theft in shelters, so things like older people's medications and money being stolen. And the overall conclusion was that older people were at particular risk of fraud and other scams both during and after disaster. There was also evidence of abandonment of older people in disaster, so particularly in the context of climate change-induced disaster, hurricanes, floods. Very sadly, there was suicides of older people. Some were never reunited with families. Certainly, we saw abandonment in the context of older people who were hospitalised or living in aged care facilities. Academic evidence of that from things like Hurricane Katrina, Japanese earthquakes, and again, COVID-19. And there were global reports, obviously, of abuse and neglect in care facilities in the context of COVID-19, which I'll cover very briefly in a sec. In terms of any solid statistics that we could find, I updated this slightly because there was some more that came out in October and has since, but there was a 20% in Victoria increase in reports of family violence incidents for people aged over 55 compared to 2019, and a doubling of Ambulance Victoria call-outs. From June last year, there was a 50% increase in older people accessing homelessness services for family violence reasons, and we know that older women are the fastest growing cohort of homeless people in Australia and have been for many years. And 2/3 of older women experiencing intimate partner violence said that the violence either started or escalated during the pandemic. So just specifically on COVID-19 in terms of drivers and risk factors for elder abuse, we know that ageism is a key driver of elder abuse. And some scholars argued that we had a parallel outbreak of ageism alongside the pandemic. So one study argued that media coverage in particular represented those over the age of 70 as all being alike with regard to being helpless, frail and unable to contribute to society. And the death of older people was considered less important or offset by economic considerations in certain contexts. One study looked at the comment sections of US articles and found that older people were described in terms such as disposable or expendable, and that the pandemic, well, this is from the UN, there was a suggestion that the pandemic may have increased intergenerational division, including anger and resentment being directed at older people for strict lockdowns, for example. And that was shown in the existence of, e.g., ageist memes such as boomer remover trending on social media in the early days of the pandemic. There was also denial of life-saving medical care, including cut-off ages for things like ventilators or ICU beds. This was at least reported in certain regions of Italy, which, as some scholars argue, licenses differential treatment of older people and sends a message about the value of their lives. And so some policy approaches that were discussed, e.g. trying to achieve herd immunity by letting the virus run through the community, certainly would have been disproportionately lethal for older people. So while there's global evidence that older people are at the greatest risk of serious illness and death from COVID-19, we also found that older people may also be at high risk of the negative consequences from those measures enacted to protect them, such as social and physical distancing. So with the first of those, which was arguably the most concerning, was that obviously older people globally have been instructed to self-isolate without physical contact from friends or family. And as with other forms of family violence, this cuts a potential victim off from their existing support networks and limits their capacity to connect with new or existing social networks. For example, older people, as I said earlier, are overrepresented normally in volunteer groups during and post-disaster. We know that, yes, having some form of social connection is critical for disclosure of incidents of family violence, and it's a conduit for things like referrals or just simply a trusted relationship for alleviating loneliness. We know that a lack of social connection for older people increases rates of depression, anxiety, and suicidal thoughts, and cognitive function can also decline without frequent and meaningful interaction, and diminished capacity and poor mental health are risk factors for elder abuse. Just in terms of some of the mental health and help-seeking behaviour data, in August last year anyway, ABS data showed that older people, perhaps contrary to expectations, were less likely than those younger to have had their emotional and mental well-being affected by the pandemic, but we still had 27% of those over the age of 65 reported as feeling nervous, 24% restless or fidgety, and so on. All the stats are there, you can read those. But we know that just 17% actually sought help from a doctor or other health professional for those mental health impacts, which of course in turn places older people at further risk of things like PTSD post-COVID-19. Of course, we also had limits in terms of physical health and access to health care. So again, we know that poor physical health and frailty place older people at greater risk of elder abuse, but many were understandably reluctant or unable to leave their homes for exercise. This, of course, means that previously active older adults were at greater risk of frailty, and that social isolation, we know, reduces mobility and can tip patients towards functional loss. Older people were less likely to utilise healthcare services during the pandemic, and services were in turn less likely to visit older people in their homes. And these limits to face-to-face contact limit the capacity to detect elder abuse and places further strain on family caregivers who may ordinarily rely on that external help. Of course, we also had an increased reliance on and use of technology. So a much greater reliance on tech to stay in touch socially, but also for things like internet shopping, groceries, medication, etc. But we know that older people continue to remain disproportionately offline. So in OECD countries, at least just over half of those aged 65 to 74 are actually online. And people with things like hearing loss and cognitive impairment were even more likely to be left behind in terms of technology use. And we also know that older people are targeted by scams in disaster. So in the UK, police confirmed a rise in online shopping scams at the beginning of the pandemic as just one example. Just got a couple more slides. Financial instability was also a risk factor that was increased during the pandemic. I know it's still happening, but I'm talking about the context of last year. So we had increasing fluctuations in stock markets. Older people experienced significant losses in superannuation and other investments. We know that younger people clearly also struggled, many of whom can be caregivers for older people, leading to many then becoming financially codependent or cohabiting with older people. And our latest analysis of Senior Rights Victoria helpline data from 2012 to 2019 shows that when we have a caregiver cohabiting with an older person, it's the second most common risk factor for that older person to experience elder abuse. That's certainly a concern. And we know that financial difficulties are also a significant risk factor for perpetrators. So 28% of cases where the perpetrator was having financial difficulties, it was a risk factor for elder abuse. And then in terms of risk factors for family caregivers, as I mentioned, not only just financial impacts, but things like anxiety, stress, and other mental health impacts obviously increased. And we know that this in turn can lead to the unhealthy use of alcohol and drugs, and all of the above are risk factors for perpetration of elder abuse. So again, from that same data set, we know that 35% of cases there was alcohol or drug or gambling issues for perpetrators of elder abuse, and in 31% of those cases there were mental health issues as a contributing factor as well. So I'm skipping a whole bunch here, but just to jump to a conclusion for the sake of time, one of the key things that we found in conclusion was that although older people are so impacted by disaster, their thoughts and opinions have really been canvassed, which is partly why we did interviews. I'll let Deb speak to that. And it has been more the case of doing things to and for older people rather than asking them what they want. There's certainly an urgent need for qualitative and quantitative data, especially in the pre-disaster context of mitigation and preparedness, as opposed to the post-disaster context of recovery and response, because we know that effective disaster management is preventative rather than reactive. Thank you.
Okay, thank you so much, Kate. And we'll now go to Dr. Deborah Parkinson, who is the manager of the Gender and Disaster Pod and an adjunct research fellow with Mudry.
Thank you, Kate. I'll start with the sample. This research with 5 women and 6 men aged 67 to 98 received ethics approval from Austin Health. In this rapid research over 12 weeks on the experiences of COVID-19 measures on older people, we captured a rare insight into the perspectives of progressive Middle Australia. The in-depth interviews with our small sample of 11 were conducted over 2 weeks to the 3rd of July. At that stage, it appeared that COVID was under control and the stage 4 lockdown was yet to happen. As this slide shows, risk factors for elder abuse shown in the left column align with impacts of COVID reported by our informants in the right-hand column, all underpinned by ageism. Ironically, measures to save the lives of older people through COVID-19 restrictions contributed to a perfect storm of elder abuse. This presentation relies heavily on our informants' words. Peace of mind was an early casualty of the pandemic, and to get through it, our informants drew on past experiences and the values they'd kept over a lifetime, values of caring for each other. In their wisdom, they recognised the structures that maintain privilege and their own fortune relative to others. This was despite a litany of ways in which their lives were the poorer for missed milestones and disrupted connections with those they love. It's essential for all of us who care about a cohesive and caring society to ask and to listen to older people, no more so than in times of disaster. So what did we hear? Rose said, "The coronavirus is out there waiting to pounce." And Omar said, "Maybe we will never escape this virus." Personal contact was restricted and deep connections were threatened, even lost for some informants, particularly those who are aged in their 80s and 90s and didn't have easy access to technologies. With the possibility of a less fulfilling future, informants were acutely aware of the threat to life and health of COVID. They lamented the loss of future travel and present connections. While most informants spoke of missing regular celebrations, some were not able to hold new babies or to attend funerals and grieve together. Henry said, "It's like the Black Death and you bring out your dead. How lonely, unfulfilling and restricted funerals have been." The stalwarts of a healthy lifestyle are good food and exercise, and the possibility of maintaining pre-COVID regimes was affected. Even going for a walk posed risk to health as the streets, paths and parks were now crowded with people from every age group seeking outdoor exercise within the regulations. Krista said, "You're invisible on the street and they just push past you, they bowl you down, they just about crash into you before they realise and then they veer off." Older people also need exercise for physical and mental health, yet their access to safe exercise was not identified or facilitated. No community service announcements or advice alerted the broader community to respect the equal rights of older people to this basic health measure. The different rules for older people in the early stage of the pandemic were noted, whereby older people were asked to just sit inside. Krista added, "That's the attitude. Young people can play sport, but not you. The advice was to just shelter inside and stay out of the way." Deanna said, "This could be detrimental to people who, if they had a bit of a walk, it would clear the mind." In the absence of other activities, cooking and eating became highlights of each day, but buying groceries held new challenges. Aged 95, Rose said, "I can remember going into one supermarket and the whole area of shelving was empty." Hank said, "I was getting annoyed with the media commentators who were saying how stupid people were taking the toilet paper. If you're living on the edge and you don't have any rice and flour, you really do need to get it." 10 of the 11 informants accessed medical care within the COVID-19 lockdown, either through telehealth appointments or in person. The precautions taken in these medical settings were comprehensive, but some people were reluctant to burden health professionals and too perceived a risk in personally attending. Lily said, "I still really worry about going to visit the doctor. I have to look whether there is anything suspicious or too crowded." Some noted fewer services, either through their own fear of contracting the virus with service providers in their homes or through some councils withdrawing services. In a disaster like COVID, careful monitoring of care with recipients can contribute to the prevention of elder abuse, so the loss was twofold. Krista said, "I had friends who were noticing that these workers weren't doing hand sanitising. They weren't wearing gloves, masks and so on." And Lily said, "There are people coming to my friend's house, do her shopping, speak with her and all that, which is important. On the other hand, she was so worrying about whether these people will be bringing COVID into her house." Several informants gave examples of sexism and how it's re-emerged in their lives during the COVID lockdown. There are cross-cutting issues. Most of the poor are women, most of the elderly are women, and most of people with disabilities in old age are women. Older women have faced a lifetime of gender discrimination. At 98, Joy spoke about the socialisation into gender roles with men not trained to do much housework, used to having women do things for them, and the implications of this in COVID isolation. She remembered when women teachers were paid 80% of the pay of men, and that when she taught English to new migrants, men got the lessons and women missed out. Joy noted men giving COVID advice on television and suggested a way to minimise this didactic and sexist method of communicating information. She said, "This is Daddy telling you what you've got to do. I'm wondering if sometimes they couldn't alter the way they present it. They could have a lady, a mum and a kids." Although racism was apparent to informants through the media rather than personal experience, several informants commented on the difficulties facing older people from culturally diverse and diverse linguistic backgrounds, particularly where they could not speak or read English well. Dependence on others for information about COVID increases their vulnerability. Terry questioned the commitment of Australia to multiculturalism in this period of COVID. He said, "Our community is multicultural. People might not have been alert to the different ways that the message was being received in ethnic communities." And Lily spoke of news reports of vandals attacking the homes of Chinese people in Knoxfield. She said, "They wrote on their front door nasty messages, window broken, etc. Not in my area, but you're still worrying. Whenever there's some news, I still would jump and read the racism about Chinese people. It can be very upsetting." For people of diverse gender and sexual identities, COVID isolation could mean a lack of social support and limited opportunities to talk about shared history. Simon said, "You need to be able to communicate with people of your own tribe. Mine is LGBTIQ. It's about someone having a talk to you, someone you can relate to." Change services may result in fears about leaving photos and memorabilia around, wondering if home carriers would treat you in an inferior way. Simon continued, "Do you have to suddenly de-homosexualise the house again as you did with your parents 50 years ago to hide who you are?" Intersectionality changes the experience people have of discrimination, and the lack of social support during COVID would be harmful, for example, to LGBTIQ plus people who might be from ethnic backgrounds. Simon said, "They might be Muslim, they might be a refugee or asylum seeker, they might be from a strict Greek or Italian background, and navigating all of that without some of the social support networks that would otherwise have been in place would be very difficult." Although none of the informants spoke of fearing homelessness for themselves as a result of COVID or of precarious financial circumstances, two informants hinted at difficulties, and one said, "Unless my business picks up, we'll have some income security problems at the end of September." Yet past adversity offered informants the belief they would make it through this disaster as they had survived hard times before. Omar said, "The immigrants accept the situation easily and comfortably, and the old generations in Australia after age 70 who have seen World War II, they accept difficult situations easily and they can cope with it." Ageism and elder abuse must be considered in the context of the gendered, social and economic structures they're part of. If ageism comes from valuing people on the basis of their economic contribution, what value does a non-productive person have? Such assumptions of non-productive older people deny the myriad ways they contribute to society. Informants to this research continue to apply their life's work and wisdom through relationships with people, through paid or volunteer work, some curtailed during COVID, and through advocacy at a policy level. Ageism also occurred through exploitation of older, retired health professionals called back into service despite the increased risk to their health. One participant in our research spoke of a double hit, with her son moving home and expectations she would cook and clean, along with her unwanted return to the paid workforce. Lily said, "I retire from teaching, but the school got back to me to do an online teaching with international students, and that was a real challenge, and I don't like it at all. It's very, very difficult." The free market is characterised by a strong work ethic and in recent decades by greater individualism and inequality. In a pandemic, the inadequacy of the free market to care for the whole population becomes evident. The World Economic Forum Executive Chairman Klaus Schwab calls for a new kind of capitalism in response to COVID, what he called a great reset to lend a voice to those who've been left behind. This echoes the views of informants who expressed a deep concern for those less well off, citing the people living in the towers who were then under duress in COVID lockdown. As Henry warned, "Don't take my situation as everyone is hunky-dory and there's nothing to worry about. I think you'd find some really poignant stories out there." Informants reflected on their fortune in being socially and financially secure in older age, and some spoke of the values the working class roots engendered in them. Rose said, "Never forget your working class roots," echoing Klaus Schwab's, who wrote, "It is in recognising shared interests and intertwined destinies that we move towards a more resilient, cohesive and sustainable world." Informants reflected on a sense of place in society. Over their lives, they recognised the structures that maintain privilege and the changes wrought in them because of adversity. Class and socioeconomic status emerged as framing their opportunities, if not their experiences. Disaster risk and recovery is premised on privilege. Those with the most resources do better, and those with the greatest wealth become richer in disasters. Considering those less fortunate, Terry spoke of the importance of funding social infrastructure. Informants reflected these values of shared humanity, and their experience of the COVID response measures brought their empathy to the fore. Henry said, "If you go back to fundamentals, villages used to look after each other. I'm a member of the human race and I'm pleased to share what I have with people who haven't. I was in that position once, but I'm not now, and I don't forget where I came from." Along with vulnerability, older people bring constructive ideas of what's needed in society and see purpose in helping. In contrast to some media portrayal of older people as frail and no longer relevant, the reality is very different. Informants spoke in passing of their continuing contributions to society in many ways. Three informants brought their high-level professional expertise to retirement, voluntarily working in policy and advocacy for LGBTIQA+ issues and cold issues. Despite this, ageism was apparent to some. Henry said, "I think we get represented as doddering, not really with it." Available literature has characterised the COVID pandemic as having a parallel outbreak of ageism. Although outside the parameters of this research, having an aged parent in a facility was of great concern to some, who saw this ill treatment of the most vulnerable old people in aged care facilities as evidence of a context that is conducive to elder abuse. For primary prevention of elder abuse, societal changes are needed to reduce stereotyping and promote diversity in all ages, abilities and cultures. The kinds of discrimination observed by informants were more evident when age was combined with other types of discrimination. Krista said, "It was clearly stated if there was a choice between who to save and who not to, that the younger person would be looked after. My life is less and less valued by people around me, and there's a whole hierarchy because the same is no doubt if you're black or if you're a woman. So men are more valuable, white men are the most valuable, and people carry those prejudices even unconsciously." In conclusion, Simon reflected, "I think the world's going to be a different place going forward. Whether it's a better world for older people is up to all of us in this window of opportunity for change." I'll finish quickly with some priority recommendations, which were about training primary prevention practitioners, replicating this research with different groups of people, considering the needs of older people at all stages of emergency management and including them, collecting disaggregated data, building digital literacy in older people, applying an intersectional lens, and perhaps most importantly, explicitly acknowledge older people's expertise, draw from their lived experience and increase representation of the diversity of older Australian Victorians in disasters. So, thank you.
Thank you so much, Kate and Deborah, for your presentations, and we'll now take some questions from the audience if I get some through. So just waiting for those to come through from you. So everyone, please remember to put your questions in the Q&A box for us, and I'm sure Kate and Deborah would love to answer those questions. But firstly, you mentioned that there's further research with different cohorts. Which groups of people in particular?
Will I go first, Kate?
Yes, sure.
You go first.
Yeah. Well, first of all, I think in terms of timeline, because our interviews were held at a time when people were thinking that we were coming out of COVID, that things were looking pretty good. And of course, straight after that, in about July, things just got worse and worse and remained pretty bad. So I think it would be great to go back to our cohort and see how they've gone over the past 12 months. But particularly it would be great to interview, because we spoke about them being sort of middle Australia, but in a progressive sense. It would be great to go for groups of people that we know have suffered badly. So, for example, cold people who were living in the towers at the time of the shutdown. Of course, Aboriginal groups. Yeah, I think there are older people with disabilities too. And we did have 3 people who were, they were gay men who participated. And there are particular needs for that group, as Liam has spoken about. Would you add to that, Kate?
Yeah, I was just thinking about Aboriginal and Torres Strait Islander populations in particular as well. I went back to the literature review today, and there's certainly evidence that Indigenous people experience poorer health outcomes in the context of pandemics compared to the Australian population, higher diagnosis, hospitalisation, intensive care admissions and so on. But when we had the H1N1 outbreak, people probably don't remember that now because of COVID-19, but in 2009 there wasn't, First Nations people were actually omitted from the National Action Plan targeting the pandemic in Australia. So that's, you know, a glaring oversight. So it'd be really interesting to see, you know, how things have shifted in the context of COVID-19 with further planning and involvement of community-controlled organisations as well.
Yeah, I think I would just add to that too. When we did this research, even though we wanted to get to elder abuse, because of safety concerns, we couldn't, it had to be one of the criteria. The people we interviewed were not in a situation of elder abuse. So once this is all over, I think it would be good to purposely recruit people who were victims or survivors of elder abuse to see how COVID affected them and what could be done differently.
Great. Well, I do have a question for you, a couple of questions actually. Right, they're all coming in thick and fast now. All right. So, yes, well, one question here is, do you know whether the participants felt that the ageism they were experiencing in different ways was being felt by their friends and other older Australians with whom they were connected?
Yeah, the interviewees were, you know, doing that thing that people do of saying, I'm okay, but other people are worse off than me. So they're talking about people, you know, within their own friendship groups, but also people that they read about or heard about in the media. So, you know, that we had those fantastic quotes about, you know, I've been in that position, I know how hard it is and I want to help. So I think that there definitely was that need that other people were suffering more than they were.
Yeah, I would agree with that. Particularly, yeah, we had a lot of, excuse me, older people talk about friends, you know, who had disabilities. There was one woman who had a friend who was vision impaired and hearing impaired as well, and she'd lost access to a lot of her in-home services. But it was really, yeah, it was quite a vexed issue when you talk to older people, because a lot of them actually didn't want service providers coming into the home because of the increased risk. So, yeah, if we listened to older people at that point in time, they were actually agreeing with the fact that it was best that they stayed out of the home, and yet that placed a lot of pressure on, you know, family members like children or siblings who were stepping in their place, and we know that's a risk factor for the abuse of older people.
Another question I have here is I'm also thinking about the communities impacted by the bushfires and then COVID and the implications for older people in those communities. Do you have any insights?
Well, really sadly, we noticed there was a 62-year-old woman who was murdered by her 64-year-old husband in Bendock, which is a town that was isolated in East Gippsland during Black Saturday. And because of our work in family violence in disasters, we know that there's a huge risk associated with disasters like bushfires, catastrophic disasters. Then you have that overlay of COVID and people being forcibly isolated. So all the community events that were possible after Black Saturday and other disasters just couldn't happen. And I don't believe we actually know what's happening in those communities yet. I don't think we will know for a little while.
Yeah, and some of the data we had around, for example, gendered violence and COVID-19, I'm just looking at the slide here that I didn't have time to present, but it was something like 53% who had previously experienced physical or sexual violence reported increases in frequency. Over 50% who experienced coercive control said it had either started or escalated in terms of emotionally abusive, harassing and controlling behaviours. So that's just like tip of the iceberg. I mean, right at the beginning, we weren't necessarily seeing increases in telephone calls because of cohabiting with perpetrators, for example, but there was 75% increase, I think, in Google searches in New South Wales after the first recorded case for help for family violence. And that's come straight on the back of the bushfires as well. So I think, you know, we're only starting to see now some of those calls being made now that restrictions are easing. So we probably don't fully understand the impact of both of those, one after the other, I'd say.
Mm-hmm. Someone has said, thanks for sharing the risk factors for older people and their caregivers. What, if any, is government's role for building protective factors to mitigate the risk of family violence before disasters happen? Can you tell us more about what these protective factors might be?
Yeah, I think that's exactly where we want action to happen before the disasters. These days with climate change, the disasters are happening really quickly, one after another. But in between those is when all of that protective work of communities needs to happen, protective work with communities as well. There's this thing about don't talk to us about violence or gender or anything. We've got an emergency on our hands. Of course they do. So in that immediate response stage, if we've set it up properly before as a preventative, proactive measure, you know, the needs of these specific groups will be taken into account, you know, in every step of it. Even the fact of having an emergency service organisation, as Steve will talk to, that has a good representation of women and different cultures and, you know, a whole diversity of people that reflects the community better. In our recommendations, we spoke about having older people on committees at every stage of disaster management, and that's really essential to do that. So I think that those two measures would be great, and they haven't happened in any significant way yet, but easy and they don't cost a lot.
Yeah, and I'd probably just add really briefly that, yeah, social support networks, particularly intergenerational connection. I was probably going to speak about this and probably will a bit more later on in the session, but they were named as one of the most probably protective factor for older people, and yet many of the people we spoke to at NARI, not only in this project, but we also ran an intergenerational project over the phone during COVID. Older people spoke at length about missing the outlet of volunteer opportunities in particular, because many of those simply ended or shut down. And the research did show that during disaster, there's often a cessation of support network opportunities or, you know, social connection opportunities for older people. So we need to find a way to ensure they continue during disaster, and they're not just online, because as we saw, a lot of older people aren't necessarily online.
And there was a question posed to you, Kate, actually, about what have you learnt from this COVID research, which may be relevant to intergenerational programs.
Yeah, so we, I won't speak too much about this because we haven't finalised the report yet, but we did run a intergenerational program for older and younger people during the pandemic, and it was just via phone or online, and I think that was key, that it was able to be done by landline as well, not just using technology, because not all older people were familiar with that technology. But yeah, we found it to be very effective in terms of keeping people socially connected, alleviating loneliness, increasing levels of social connectedness, and in fact, changing older people's internalised ageism by nature of connecting with a younger person in a meaningful fashion. And they really appreciated that opportunity to act as almost a mentor to that younger person in terms of their experience of, e.g. disaster, but also just career and life advice. And our younger people really benefited from the program too. So I think going forward, we really need to explore more of those opportunities.
Another question is, I'd be interested in the impact of the pandemic on older people, me, who are still working. For example, are they encouraged to retire or resign? Can we segregate the age groups of older people?
It's interesting because one of our respondents, one of our informants, actually said that she had to go back into the workforce and she didn't want to, and she found it really hard to do that. So I think it operates at both levels. You know, there's discrimination in the sense of, well, your life is perhaps a bit more dispensable than that of a younger person, so you can take the risk. Or it's, well, hang on, we need a younger person to have that work, that paid work. So ageism can certainly operate right across the board with that. You know, one thing that might work is to improve our communications around that, and to have some more, like when they have people talking about what to do in this emergency, they're usually men, and they're usually men in uniform. This is the authorities talking about regulations. So it would be good to have diversity of older people's voices in there as well.
Yeah, as Deb said, I'd probably just say that we need a really strong gendered lens on that as well, because we know that, you know, for those who were still working, the reduction in hours was much greater for women. And they also represented the majority of those ineligible for JobKeeper, and had a disproportionate burden in terms of caring for older relatives and children, which is the case outside of a pandemic, but got worse during the pandemic as well. So, and as I mentioned before, you know, many women are still working because they're more likely to be living in poverty, to have less superannuation, and also are the fastest growing cohort of homeless people in Australia. So many of those, you know, older women had to keep working during the pandemic, but suffered reduction in hours and increase on their other demands.
Great. Well, one final question, I think, before we break for morning tea, but this person has said, thanks for the great insights. Was there any further insights on experiences from older people living in regional and rural areas, sorry if I can get it out, versus urban and city areas?
No, that's the fault of our sample, and it's a huge limitation that we noted. And I should have mentioned that that's a cohort that we definitely need to replicate this research with. I think, you know, having grown up in the country and lived most of my life there are definite issues that affect regional and rural people that don't affect people in the city, particularly in relation to health and access to health and health services. So I think that should be high on our list of what to do next.
Yeah, we not in this particular project, but we certainly had regional Victorians involved in our intergenerational program, and in fact that was having it available via phone or online was a real enabler of their participation. So I'd say that yeah, we need to be smart about social connection in the context of distance in terms of where people live, because our regional participants found that a really important outlet for social connection.
Great. Well, thank you so much, Kate and Deborah, for joining us this morning. It was really great to hear from you both.
Thank you. You've got me again for the next 23 minutes. I feel like I should apologise. This is the second project that we did with Respect Victoria, and it was looking at the impacts of the COVID-19 pandemic on Victoria's primary prevention workforce. The aims of the project were in more detail to explore the pressures that government, local councils and women's and family violence services were under to divert resources from primary prevention to response and other COVID-related urgencies during the pandemic. The more specific aims were to gain insight into the impact of COVID-19 on the primary prevention workforce in Victoria, to make recommendations about resourcing and support needed for primary prevention practitioners during disaster, and to produce a report for Respect Victoria. What I want to do is I want to give you just a diagram that's going to frame what I'm going to say in this presentation. We know that discrimination against women is due to gender-based structural inequalities, which we've heard talked about today. We know that for women from minority populations, intersecting forms of structural inequality ramp up, those gender-based inequalities. And we know that the interactions of gender-based and other forms of structural inequality shape women's work and their home lives. Now, if you hold that diagram in your head, that's where I'm going to place the work will be primary prevention, family violence primary prevention. And as we'll look at the results of the interview data with workers, it's the relationship between home and work that proved to be particularly problematic and difficult. I'm going to be talking both about the LIT review and about the results. The LIT review will be those two background slides. We'll be looking at the impacts of disaster and particularly COVID-19 on gender-based inequalities and how those interact with other forms of structural inequality, placing minority women at increased risk for family violence during COVID-19 and disasters. The LIT review, there was no material looking at primary prevention workforce. So we used the LIT review to set up that broader context of gender-based violence and intersecting forms of discrimination. The terms of reference of the literature review, which was conducted by Dr. Catherine Orion-Weiss, who's not here to present today, unfortunately. The LIT review looked at the gendered impacts of COVID-19 and other disasters on the division of labour, on male and female stereotypes, and on family and intimate partner violence in heterosexual relationships and what I'm calling heterogendered nuclear family arrangements. So it's a very particular cohort. The sources that Catherine accessed were the primary Australian resources, but she also used resources from other countries similar to Australia when there were clear gaps in the research. Catherine searched peer-reviewed articles, published articles, grey literature, and again, media and newspaper resource. And she used a very limited focus set of search terms, and I've given just some of them: COVID-19, coronavirus, Australia, family violence. So if you think about that initial diagram and you think about the gender drivers of violence against women and you think about the intersecting ones, I want to talk about two indicators of increased gender-based violence. One was the gender division of labour under COVID, and the second was the increasing polarisation of gender stereotypes. So I'll go through the first. Catherine showed that in Australia, or Catherine's review showed that in Australia and similar countries, stay-at-home measures aimed at minimising the spread of COVID-19 were pressuring women to take up the bulk of increased caring, emotional and domestic duties. The review also showed that in taking up those duties, many women, taking up those duties were coming at the expense of paid employment for many of those women. A UK study done early in 2020 or early in the epidemic showed that mothers are 1.5 times more likely than fathers to have quit or lost their jobs following COVID-19 lockdown. And the preliminary findings of an Australian study showed that in heterosexual nuclear families, there was an increase of 6 hours per day of childcare during that first lockdown in COVID. 4 hours were falling to women and 2 to men. And women were doing 70 minutes of housework per day compared to 30 minutes per day by their male partners. In Australia, the income losses under COVID-19 have been further compromised women's material and financial independence. The first rafts of federal subsidies favoured male-dominated industries such as trades and construction, and women, and in particular young women, were overrepresented in those sectors that experienced significant job losses but did not receive similar types or levels of government financial assistance, including retail, the creative arts and entertainment. So if that's one, looking at one set of increased gender-based inequalities around economics, the second that Catherine looked at was the increasing polarisation of really quite damaging stereotypes. She showed that during disasters generally, not just COVID, women's reduced economic independence during and after disasters reflected and amplified existing highly polarised and damaging gender stereotypes. So for example, after Hurricane Katrina in the US, media reports depicted men as heroes, active and in control, while women appeared as helpless, vulnerable and in need of protection. Variations of these highly polarised representations of men and women are a feature of media reporting of disasters more broadly, including COVID-19. And Naolin, who's an Irish academic, describes this form of what she calls disaster masculinity as hypermasculinity, in which strength, control and aggressiveness are seen as paramount. A US study, which was unpublished at the time Catherine did the Lit Review, found increasing conformity to and belief in traditional gender roles over the course of the COVID-19 pandemic. Now, this increasing polarisation of gender stereotypes under disaster conditions involves an amplification of the already unequal gendered sexual relations between women and men and brings with it an increased risk of family violence. So Austin and Parkinson have both shown that some men use their failure to live up to this hypermasculine ideal under and post-disasters as justification for abuse and violence. They're letting off steam with all the pressure. And Fothergill argued that both male perpetrators and many in the wider community believe that increased pressures that men are under, particularly male heroes, categorised as such under disaster conditions and after disasters, is sufficient excuse for their losing control. So if that sets the scene for increasing gender-based inequalities under disaster, looking at both reduced economic independence for women and an increase in these polarised gender stereotypes. Catherine then looked at intersecting forms of discrimination which placed minority and marginal women at even increased risk of violence during and after disasters. And I'm just going to take you through fairly quickly some of the data, much more detailed in Catherine's Lit Review, which was an extensive and exhaustive piece of work. So she looked at age. She found that younger and older women were both at higher risk of violence and discrimination during and after disasters. Young women, particularly young single mothers, were overrepresented in those sectors experiencing the greatest job losses during COVID. In the UK, nearly 80% of those who'd lost their jobs since the first lockdown were women, and of that 80%, 2/3 of those women were aged between 18 and 34. And older women were overrepresented in home-based and residential aged care, where, of course, as both Kate and Deb have said, were fearful of increased risk of contracting COVID. And so they had reduced access to services and people coming into their homes. In Australia, Aboriginal women, Andrews reported that Aboriginal women who may be at increased risk of family violence due to reduce access to traditional kinship networks following social distancing restrictions. And there was concern expressed that Aboriginal women who are overrepresented in the prison population may also be at increased risk of contracting the virus. And again, remember that this, we're talking about a Lit Review and project that was done between June and September last year. Citizenship status. Migrant women have been disproportionately affected by the pandemic. Madola reported they were overrepresented in precarious employment, so subject to those economic limitations. They were often responsible for the bulk of caring and domestic work, less likely to have access to the supports they needed, particularly culturally appropriate services, and were therefore at higher risk of family violence. Women on temporary visas, or those women who had no documentation, were overrepresented again in low-income jobs. They were not eligible for the government's job seeker payments and job seeker schemes, and when they weren't eligible at that stage for Medicare and did not have affordable access to health and social services, including contraception and abortion. Ability, women with disabilities, the carer payments nor disability pensions were increased in that first raft of economic relief measures. Women with disabilities had reduced access to support workers. And Baird argued that women who had relied on disability support services to intervene on their behalf in actual potential violent situations were now at increased risk of family violence. And rural and regional women, women in rural and remote areas already had reduced access to services. There's possibility that that reduced access would increase under COVID. The barriers to service access are likely to have increased under COVID-19, and the increased web-based technologies may have had longer-term benefits to women, and I know Kate talked about that, in regional areas by increasing their options for work and health service access. And the final group of minority women that's included in the LIT review were sexuality and gender diverse women. I abbreviate that as LBT, but that could also include women who identify as gay. LBT women are overrepresented in those sectors most heavily impacted by COVID. We've seen that already. There were reports of lesbian, bisexual and trans women having to return to abusive families of origin or to remain in violent relationships because of COVID-related financial hardships. And many LGBT women are wary of accessing mainstream services because of a history of institutional and professional abuse, which might have minimised their willingness to access family violence services. I want to use this slide, the tyranny of the urgent, to move from the LIT review into the actual research. And Catherine ends her LIT review by talking about the tyranny of the urgent. And this refers to the pressure on governments and key agencies to respond to the immediate effects of disaster, often at the expense of longer-term initiatives and goals. And she quotes two pieces of research. One was research looking at low-income countries during disaster, and it documented the redirection of funds from long-term infrastructure projects targeting the poor and disadvantaged to urgent reconstruction work following disasters, and also research on the impacts of public health disasters, showing that medical funds have been redirected from ongoing healthcare programs to deal with the increase in urgent cases arising from the health crisis, which might be something like COVID-19. So really the question that we pose in the research is that tyranny of the urgent putting pressure on family violence prevention agencies to move resources from longer term programs aimed at preventing violence to the response? And I've just pulled out one bit of stats. There are many, many more. In Australia, the federal government reported a 75% increase in Google searches for domestic violence support following the first lockdowns, while calls to the Men's Referral Service increased by 94% following the announcement of stage 3 restrictions. So what we're arguing is the tyranny of the urgent may well be acting on family violence prevention agencies and pressuring them to divert resources from prevention into response. And I've just put there over 90% of the family violence primary prevention workforce in Australia or in Victoria are women. And I'd like you to keep that in mind as we go through the results to the survey. So if the LIT review set the stage, it looked at gender-based inequality and intercepting forms of structural inequality and the impacts on women during COVID-19. What I want to do now is look at the results to the interview data with workers in primary prevention to talk about work and home and the changing relationship between the two in that context of increasing gender inequalities under COVID-19. So I'll give you a little bit of background on the research. We did a group consultation, a 40-minute Zoom group consultation with members who attended Municipal Association of Victoria's Prevention Against Violence Women's Working Network. I'm going to get completely tongue-tied at the moment. And that was done on June the 17th on 2020. Attendees were randomly assigned to a breakout group of 6 and asked a general question: how has your role in prevention of violence against women changed under COVID-19 conditions? I then conducted interviews with informants, 5 in all, recruited between the 17th of June and the 16th of August. There were 5 Zoom interviews. All the informants identified as women. 3 worked for local councils, 1 worked at a multicultural women's organisation, and 1 worked in research and practice for a major family violence prevention agency. And they all had responsibility within their jobs for primary prevention to varying degrees. The interviews were semi-structured and consisted of a series of open-ended questions. We started with just asking generally, what do you think the impact of COVID-19 has been on people's work lives? Then we asked them about any shifts or changes within their organisation since the onset of the pandemic and the restrictions. We then asked more specific questions about their roles within the organisation before and during the pandemic, in particular their work in primary prevention. And we concluded by asking them about what could be improved in the future, given what they'd learnt about the impact of the pandemic on their primary prevention work. So let me take you through the results. And I divided these into work and home, as you saw in the diagram. We did in fact find that there had been a transfer of resources from prevention to response. All informants had, to differing degrees, taken up additional duties related to response, including information and resource development, delivery of training around response, sometimes to staff, sometimes to clients. And they had been increasingly involved in media and publicity, actually making sense of to their constituents these dramatic increases in reports of family violence. And I'm pulling out just indicative quotes here. So one respondent said, we trained up 14 family violence contacts across the organisation, and it's not even necessarily my role because I don't do work in response, I never have. Now there's about 10 different guidelines, trainings, groups that are in place that weren't pre-COVID. Another respondent, there definitely has been a shift into more response. It's all really divided, and the focus on external requests is mostly on response right now. Second, we also know there was documented the transfer of resources from prevention to COVID-19 duties not related to family violence at all. So a number of informants have been redirected to help develop resources and tools to ensure the safe delivery of programs and services online and the safety of staff as they transition from work to home. So again, we design training for frontline workers as well as managers and people within the organisation, knowing that they're going to have the whole organisation working at home on safety issues, and I guess organisational responsibility and duty of care to ensure that our workers are safe working from home. A number of informants had also been redirected to operational issues not related to family violence at all. Levels of organisational support. None of our informants have been provided with additional resources, funding or personnel to backfill their primary prevention work. No consideration have been given to the immediate or medium long-term impacts of the transfer of resources on primary prevention policies and programs more broadly, but also on the health and well-being of the primary prevention workers who had to take responsibility for how to juggle the shift from prevention to response and other duties. And only one of our informants had been consulted on policy and program decisions to transfer resources from primary prevention to response. We call this from primary prevention, response and back again. All of our respondents talked about the dramatic increase in family violence under COVID-19 and the pressure to respond had actually raised awareness of family violence as a systemic problem within their organisation. Their shift to response work had given them access to a range of policy and program areas they had not had access to prior to COVID-19. And they said it actually provided them with opportunities to raise the profile of primary prevention within their organisation and the need to bring a gender equity lens to all of the organisation's policies, programs and procedures, many of which had not seen themselves as contributing to primary prevention. A number of respondents also identified the passage of the Gender Equality Act as providing further incentives for organisation to address primary prevention. So this sums up, I think, those workers who felt that the shift actually was also providing opportunities. The role that I've taken on in the response side and training up a whole lot of our organisation and getting policies and procedures around family violence has actually raised the profile of gender equality and finally family violence prevention work within the organisation. I think that will have ongoing benefits. Some other work-related concerns. The move to exclusively online or virtual meetings had significant impacts on all our informants' work, including how decisions were made, professional relationships and interactions, and also access to staff across the organisation. Some informants had greater access to formal meetings via Zoom than they had previously, and improved access to program areas and senior staff they had little or no contact with prior to COVID-19. Others, however, found the loss of informal discussions or chance meetings, bumping into people in the kitchen or the corridor, actually increased barriers to inclusion and information and decision making. So this is again an indicative quote. Going into the office, you would be part of an environment where you're hearing conversations or attending meetings and absorbing that knowledge or the experience just being in the room, and that's not happening. The shift to organised virtual meetings also minimised some of the face-to-face embodied ways in which gender and gender inequality operated in meetings. So 2 of our respondents said in the online forums they actually didn't feel silenced by virtue of their gender. And this is one woman. She said, no one's interrupting you in meetings. So if you've got to say something around gender, you've got the space to actually say it. You're feeling that resistance and that pushback, but it's almost better not having that in some ways at times. You just progress with it. Some other work-related issues, there were issues around safety. The sudden move to online delivery raised safety issues for both practitioners and clients. There are a need to review safety protocols for online training and delivery, particularly if you're doing it online and you trigger somebody who has had an experience or someone they know has had an experience of family violence. If someone wants to disclose during a training or session that they've experienced family violence. And I think, as Kate said earlier, perpetrators may actually be in the home during online sessions. So this is one of our respondents said, I could be delivering to 12 people who never met each other, and we're asking them to talk about primary prevention and family violence. It's quite confronting and really hard to engage and elicit conversations through this video medium. Primary prevention practitioners expressed concerns that they may not be fully qualified to undertake some of their new professional duties. That's the transfer to response. And there were issues of access and appropriateness of online delivery to women from coal backgrounds, to Indigenous women and women in rural and remote areas. Very quickly, some of the major issues that were raised around home, as you can well imagine, balancing work and childcare. All of our informants were women. 3 of our informants have primary or preschool aged children. All those 3 talked of increased childcare and domestic duties. Homeschooling was a big issue, and negotiating COVID domestic responsibilities with their male partners. So another quote, my partner's work has not been affected. He can still go to the office, work his normal workload on a Monday to Friday basis. I work part-time. Homeschooling or remote learning has been a really big challenge for us. Another one, it's had huge impact. The negatives, the personal, like it's hard to balance it all. Demarcating a professional space at home, as one respondent said, and that's a bit of a challenge too. I go from the kitchen to the office. Maintaining professionalism. A number of women said it was very challenging. The juggle that everyone is going through, and it's a very gendered issue of juggling childcare, homeschooling, as well as work, has been significant, and I feel I haven't been able to give full attention to either. And there were workload issues. All of our informants said their workload had actually increased, and all talked of the need for increased self-care. On the positive side, all talked about increasing management and flexibility options. They talked about, as again, I think as Kate and Deb and others have said, reduced travel. And they all talked about building up new skills, particularly around technology. So, what would I say? This is a highly gendered issue. You have 90% of the workforce is women. They're managing changes at work. They're balancing the shift from prevention to response. They're managing changes at home, increasing domestic and caring duties, and perhaps just as problematic is they're being asked to manage the changing relationships between home and work. And we see that reflected in the recommendations, and I'm just going to give you a taste. There were 24 recommendations under 4 categories. I haven't put in research, but evidence-based policy and programs. We recommended that family violence policies have a section addressing the impacts of disaster. We argued that disaster planning look at the impacts on family violence. We suggested that disaster planning at a state level and an organisational level address the tyranny of the urgent in advance, and I think Deb has talked about this, and make sure that under a disaster like COVID, there will not be a transfer of resources from prevention to response. They have other ways of addressing that issue. We talked about enabling environments for women, gender dynamics of decision making. These women were not included in the policy and program decisions, but nonetheless impacted their work and their home life and the relationship between the two. Training and prevention in response. We suggest that response workers will know something obviously about prevention, but are trained up just as workers in response are trained up in prevention, because there will be a mixing of those two more formally within organisations under disaster conditions. Increase resources and supports for women managing the shifts in work, home and the relationship between the two. And the third area is workforce support and development. Apply a gender lens in the development of staff mental health and wellbeing initiatives, because the burden of the mental health, the issues around shifting your work from prevention to response, managing the relationships between home and work, this is a highly gendered issue in the primary prevention, family violence, primary prevention space. Development of new safety protocols for the delivery of online prevention and response training, and to embed gender equity and primary prevention in organisational policies, procedures and programs, because those women who said it had opened up much more room to discuss primary prevention across the organisation wanted to see that that discussion actually then led to that being embedded in future planning for the organisation as a whole. And that's me.
Thank you so much for that, Liam. I just had trouble with my technology there. Yeah, we'd like to take some questions again for Liam, and also Deborah Parkinson is joining us again as well. Deb is the manager of the Gender and Disaster Pod and is an adjunct research fellow with Mudry, so she's going to join us for this little question time as well. So welcome back, Deb. We do have a couple of questions here. Remember to please put your questions in the Q&A box for us so that we can get through them as much as possible. So the first question I have is, are the literature reviews publicly available? These could be useful to help inform local level PFV action plans and build the evidence base for local council. Oh, sorry, it's just jumped. Where is it? Oh, gosh. Sorry about that. Yeah, action plans and build the evidence base for local council obligations under the GE Act, example, gender impact assessments.
The literature reviews have not been released independently for this or the LGBTI project that I'm part of, but hopefully that will happen. And yes, I do think they'd be very helpful in future planning. Both reports are available on the GADPOD, the Respect Victoria site. And the lit reviews for the two projects, particularly for this one, Catherine did an exhaustive lit review, and it really does give you an understanding of the structural determinants of increased risk of family violence for women under disasters, including COVID-19. So yes, hopefully they will be made available.
Okay, so the next question, I've heard that there was a lot of pivoting early in the pandemic and redirection of the prevention workforce to response. However, I'm just wondering if this effect has been sustained in 2021. I've heard anecdotally that now this pivoting has now pretty much stabilised and the prevention workforce are going back to main duties, but this might not be the experience of the broader prevention workforce.
I'll talk to that, and then perhaps Deb will have something to say. I need to remind people we did this in June, September, when we were going from, I think, into the second, about the third lockdown. And so things were still in a sort of panic mode. I have no idea about what's happened since, but I do think, as Deb said about the project around older people, that there is a real opportunity to go back and revisit both the same people we interviewed, but a broader range of people, to see, as this question implies, that perhaps things have settled and that primary prevention workers are now going back to work on primary prevention. However, at the same time, it's worth looking at, if that's the case, whether or not the actual primary prevention framework and work within those organisations has shifted, because they're not actually related. A number of the people we interviewed were concerned about the medium longer term impacts within their organisation and at a policy level more broadly of this shift of resources, even if they move back. You never move back to the same situation, not just because COVID has not set still, but you don't move back to the same situation when for 6 or 8 or 10 months, the area you worked in has actually had decreased funds. So there are at least 2 things going on. One is to check, as you say, or this question suggests, the workforce might be moving back, but there is still a separate set of questions about what are the impacts on that workforce and that work of transferring resources during those first 2 lockdown phases.
Deb,
Yeah.
would you like to add something there?
Yeah, I would. Thank you. Thanks, Liam. Yeah, I think, you know how they talk about COVID being a global experiment, you know, things are happening that nobody expected to ever happen. So the sustained nature of the COVID response measures, particularly the going in and out of lockdown in Victoria, I think has been fascinating to see what's happening in different organisations. So if there are some organisations that have been able to quickly develop policies to make sure that you know, that removal of people from their primary prevention job to response, to make sure that doesn't happen, what have they done? What are the practice changes? You know, how have they educated their workforce for that? So there's some really great opportunities for research to gather that good practice. And I suppose in Victoria with the Gender Equality Act, it could be a case study that's there on the Commissioner's website.
Right. So the next question is, what opportunities do you see to support primary prevention in emergency management planning?
Oh, Deb, I think you should start with that one, but I can just say briefly, in all of Deb's research, which you talked to, shows that under disaster conditions and post-disaster, there's an increase in family violence. So the first thing is just to get that built into family violence, to understand that under disaster conditions, there are gendered implications, and we need to consider those in advance. And it's all the things we've looked at in this project. But that's really a gross answer to a question that I know, Deb, you can give much more flesh to.
Yeah, I can add to it, and I think Steve can also add to it further. But I would suggest that cross-pollination that you spoke to, Liam, is really essential. So what we know in primary prevention needs to be taken up by the emergency management sector. And of course, we know that there will be that same resistance of, no, we treat everyone the same. There's no need for us. And by the way, what does family violence have with what we do? So it's about us and other educators making that links for them, and people like Steve helping to really make that an embedded part in emergency response to disasters.
I have one more question. The tyranny of the urgent is a valid challenge and further evidences the need for greater investment in prevention rather than at the expense of response services. Advocacy will therefore be very important, and of course collective advocacy. How do you think we can best use this evidence and work more cohesively to advocate for increased investment in prevention? It's a very long question.
You know, primary prevention looks at the drivers and the causes of increased rates, or well, of violence against women, but increased rates under disaster. And a number of respondents in the survey talked about their organisations not really understanding that, not taking a gender lens to all of their work, let alone a gender lens to issues around the increase in family violence under disaster. So those who were optimistic said that the increased profile, because of the dramatic increase in reporting of family violence, really was giving them an opportunity to go back post-COVID, whenever that actually happens, but during this period as well, perhaps, and to push that within their organisations, to make sure that the Gender Equality Act, the increased understandings that had come through because of COVID, started to be embedded at senior policy level within their organisation. A greater understanding of the importance of the drivers of violence against women, a greater understanding of how those are implicated in disaster, and to get those built into policy and program responses so that when we go through the next disaster, processes are in place that you won't be transferring resources. Because as everybody pointed out, it's ironic that resources get transferred to response at a time when the drivers and the gendered inequality that drive those increased rates are being reduced. And you don't want to see that happening again. But the tyranny of the urgent, as again Deb can talk, it just cycles through. We get this knowledge, people don't embed it, we go on, things go back to a new sort of normal, the next crisis occurs and we're back to a response, and yet that learning and that understanding hasn't really found its way into systems of processes and policy. It can be done at a government level as well, around family violence and around disaster and response planning and policy.
Yeah, I would add to that and absolutely agree. It's so ironic that just when we need those primary prevention practitioners to speak about how dangerous it is to see that return to rigid stereotyping and all the other things that we know are drivers and risk factors, is when they're pulled onto response. So we do need to make sure that they're there constantly. And I would just really emphasise that return to rigid stereotyping is a huge risk for gender equality, and it's a huge risk for violence against all the different groups that suffer violence in our society. I was just looking at a BBC article that said we're going to be looking at a male-dominated workforce because women are thinking, well, I've got this opportunity to work from home. It's easy to look after the kids or mum or whatever, so I'm going to work from home extra. And the research there in England was saying that men want to go back into the workforce. So we know how damaging this would be. And it would seem to me like Iceland has fantastic parental leave policies that insist on equality of women and men taking the same leave. Organisations could simply say men and women have to take the same number of days at home if they're going to do that.
Well, thank you so much, Liam, for that presentation, and thanks to Deb for joining us again for that Q&A. And we'll see you back later on for another Q&A. But next up, we have our next speaker, and I'd like to introduce Steve O'Malley. So Steve O'Malley is a Fire Rescue Victoria firefighter with more than 30 years experience and an Australian Fire Services medal. He is a long-time GAD-POD associate and trainer, and Steve's topic today is how do the results of these studies provide insights into future disaster work, including bushfires. So over to you, Steve. Welcome.
Thanks so much, Carla. And I'd like to start by acknowledging the traditional owners on the land in which I am on today, which is the City of Melbourne, so Wurundjeri people of the Kulin Nation, and acknowledge those elders past, present and emerging as well. And to say that when we present and speak about this, I certainly acknowledge the voices of the victims and survivors of violence without a shadow of a doubt, because they're the ones that inform any of that research that underpins the programming and the innovation and the training. So you know, kudos to Respect Vic for this forum as well, because I think it's really important. What I can do is talk about emergency management, yes, but at a certain level. I've been in the violence prevention sector for a period of time as well, so for more than a decade and a half. So I've got a little bit of experience there, but certainly not a subject matter expert neither. But what I do is educate myself on the matters of violence prevention and certainly gender equality, gender equity more relevantly. So kind of what I want to talk about a little bit about today, and yes, looking into the future a little bit, but sort of where we've landed in the last decade from when Deb and Claire, who I'd like to acknowledge as well, is no longer with us, Claire Zara. So from Deb's and Claire's research back a decade ago, or more than a decade now, to where we've landed now and what we know and how we can sort of shape how we do recovery, how we do coalface engagement, how we handle disclosures, say to be more specific, and how we respond and how we sort of prepare for disasters as well. So the vernacular's changed a little bit, and when we train and when we speak about disasters as being not so much natural anymore, because there's a social context to all disasters. If we're talking about a COVID context now, or the COVID disaster, it's absolutely got you know, human DNA all over it. If we talk about what was termed natural disasters back in the day, cyclone, fire, which is predominantly what we get here, floods that we've gone through just recently, we can speak more to climate change and more to global warming and talk about the human impact there as well. So less about natural disasters and more about disasters in general. And it's sort of, and we know that through the COVID lockdown period and through COVID itself, that there's been a lot of crossover and similarities between what happens in a bushfire scenario, say, which is where we started off our interaction down in Bairnsdale during the Black Summer, and the COVID-19 scenario, albeit a much, much more fraught scenario, that COVID one, on top of an already a disaster that communities were dealing with. So the responsibilities of the continuum that the emergency management sector operates by is the preparedness, prevention, response and recovery continuum. And what I'd kind of like to talk about at work in our sector, in the fire services sector particularly, is the similarity between that and the health promotion or the sociological sort of socio-ecological model that I think Beth mentioned earlier, where we're looking at, when we do our prevention work, we're looking at individuals and we're looking at organisations, communities, and wider societal sort of change as well. In primary prevention, essentially, the prevention of a fire, for want of a better word, or a disaster, for want of a bigger picture scenario, that's our core business. So the language of prevention, the language of risk identification and risk mitigation, but certainly prevention is one of the is the language that we use quite often. So, and it's primary prevention. It's stopping it before it happens. The same sort of language that we use in the prevention of violence against women or in domestic family violence as well. So there are some similarities we can run with there. That we talk about, upstream, the same way that we do in the primary to tertiary sphere of the prevention continuum. And I think that that's the way that we need to approach it. There was one of the words that has been used over the last decade or so is interoperability, and I'd like to introduce another, I think it's around about 7-syllable word to the sector, if I could, which is intersectionality. And we don't talk about intersectionality as much as we should, because that would enable us to actually, cast a lens, albeit a gendered lens, but more an intersectionality lens onto how we do our core business, which is respond, but also that other period of time when we're preparing and preventing disasters as well. So intersectionalities, that's kind of where I see the conversation going in regards to violence prevention into the future. Deb's right about the cross-pollination, or Deb and Liam are both right about the cross-pollination and the fact that already as part of our core business, we respond to family violence or to domestic violence, and we don't even know that we're doing it quite often in an emergency management, an emergency medical response scenario where we're turning out like ambulance to someone who is injured in a house, and she may present as a victim of domestic violence. We may not have those tools where we can actually identify that. And that's, I think, is a really good sort of first entry point for our staff. And I know ambulance has done some good work, and certainly police, because it's their core business. So the identification of what we're talking about in a domestic family violence scenario, I think, is a really good starting point for our people to actually become cognizant with the concepts of family violence. What I will say is that in our enterprise bargaining agreement, we have family violence as a clause within family violence leave, that is, as a clause within that agreement. So it is a concept that people can draw from, if not from that industrial enterprise agreement. We also have a cohort of people who are family violence contact officers. So we have done some training within an organisation like ours. I think where we're at the moment is that we've undergone some major change in our organisation, a fire services reform, where once we were a 1,000 square kilometre, the Metropolitan Fire Brigade, now as Fire Rescue Victoria, we whole of state coverage, as well as the CFA in their volunteer capacity in certain areas that certainly cross over. But our focus now has to be statewide, and our disasters that we respond to now take on a different form to what we were used to as an urban-only fire service back before the reform in July 1 last year. So there's a fair bit of work to do there. In regards to the violence prevention or that crossover or cross-pollination that Deb mentioned, I think that's another starting point in that CFA career firefighters, although they have the same family and corporate staff have the same family violence leave provisions within their organisation. It's incumbent on the organisation to train up contact officers so there's a point of disclosure and a clear line of confidentiality into the organisation when that leave needs to be used, if it needs to be used at all. So that's kind of where we're at the moment. I know that where we can look to in the future is an outcomes framework that our commissioner certainly has championed and is very excited about, which has, four pillars, and those pillars might be obvious to most, but they're around community, around our service to community, around people, our people particularly, and the values within the organisation, and collaboration. So working in partnership with other statutory organisations like Respect Victoria, and sectors like the family violence prevention sector, because we're talking about whole of community safety. So that also will include what the community perceive to be their needs as far as being safe as well, which includes family domestic violence, domestic abuse, whatever other term you want to use. So the systematic discrimination or systemic discrimination is another issue that has been touched on throughout the course of the presentations, and I think we're at a time in not too far down the track where we should, as an organisation, be able to delve a lot more into unconscious or conscious discrimination through the systems we have in place. And there's a good opportunity because even just this morning, our commissioner has announced that we will be increasing the amount of recruits by about 240, I think it is, new recruits into the organisation. So that gives an opportunity for us to be able to, as Deb said, recruit with an intersectional lens. Certainly gender is high on the priority list, and we're encouraging women to join organisations like that are predominantly male-dominated, like fire services. But people from cold backgrounds and people from Aboriginal and Torres Strait Islander backgrounds as well. Our First Nations people aren't represented very well within the fire services. And that'll enable us to have a much more intimate relationship with the communities we serve as well. You have to be. I get quite fearful of the othering scenario in that we, put people into a group, say for instance, and we treat them differently, as Deb alluded to. Once upon a time, the mindset of the emergency response organisations like fire services was that we treat everyone the same. It made our job easier that we could operate, just with that narrow lens that doesn't matter where you're from, it doesn't matter your ethnicity, it doesn't matter your faith group or your size or your gender, we treat everyone the same. But I think we've come a ways since then, and I think there's a lot more we can do to actually address, intersectionality in communities, and we can do that by looking at it through the recruit lens as well. So represent the community in which we serve. I know that's an aspirational goal of a lot of organisations out there, but if we are recruiting at the rate that we will be, and the workforce sort of turning over, as it will, into the future as well, with natural attrition of old fireys like myself, well, then we will be in good stead to actually represent the community a lot closer than we do at the moment. So I think I'm quite excited at the prospect of that. And once again, we've already, as I said before, we already use terms and we already have operating procedures which look at our own safety, the safety of firefighters and the safety of the community as well. It's interesting that concepts like intersectionality, hopefully if they creep into the vernacular, the discussions at stations and the discussion at executive leadership levels and senior leadership levels, we'll start a discourse that maybe into the future will have the fire services look a lot differently. The gender side to the training that we do through the Gender and Disaster Pod, which was born out of a task force back in 2014, is a really important entree for organisations like our fire service and not just in Victoria, but nationally, for organisations to actually start to cast a gender lens on their policies and procedures within their organisations, the way they recruit. And we know that in Victoria, there's legislation now that organisations such as ours have to report into, and it goes to Liam's slides about work, about the amount of work that women have had to do in the pandemic as well, and a lot of the time at home. In that the reporting on that gender legislation has been pushed back to December now, and I think that's indicative of the fact that, and I may be wrong, but most of that work, most of that auditing, most of the requirements in that legislation are being done by women in those 300 odd workplaces, I think it is, that need to report into on the legislation. So I'm optimistic about how we move and how we can look more closely at gender, and by sort of debunking that, or by addressing that determinant of gendered violence, which is that adherence to strict gendered stereotypes, which the fire service has writ large. If we can tip that on its head, we can be an organisation that is inclusive. We can be an organisation that actually recognises that the hero narrative just doesn't, wash necessarily anymore, and that we can have an impact in communities in a prevention sense, particularly around gendered violence. I think I'm to time. Is that good, Carla?
Sorry about that, Steve. I just had to take myself off mute. Yeah, you've gone very well to time. Excellent. And just looking at some questions here for you. There's a couple, so we might just go through those now. So Fire Rescue Vic response to family violence as service to community, but also a very gendered workforce. How are these elements being addressed?
I think Beth actually touched on it earlier when she mentioned the fact that primary prevention and the risk factors, they're quite complicated. So it's kind of small steps at first. And as I said earlier, we need to acknowledge what is already in place in the organisation. We have amazing peer support networks. We have some great mental health first aid that goes with our, in conjunction with our operational capacity. So the firefighters and corporate staff are taken care of pretty well when it comes to that. But we can't, there's also historically a feeling that that fireys can fix a lot of problems in the community when they're in response phase, say for instance, which is what most of the people who join to be firefighters want to do. They want to be able to respond. They want to be able to take care of community. They want a positive outcome. So I would be cautious about how our operational crews are introduced to concepts of disclosure in a scenario where it may be a domestic family violence scenario. But I also think that we should be in that space somehow, because the recommendations, and I think Amy led with it at the start, violence prevention is everyone's business. I mean, the recommendations from the Royal Commission to Family Violence didn't say it was any one organisation's business. It's a whole of community stuff that we're talking about. And organisations like ours, who are, that stereotypical male organisation, who can do concerted gender inclusion and intersectionality as a core of their recruit strategies, I think we're well placed to actually do a little bit more.
Excellent. Now, someone says it's refreshing to hear the work currently underway at FSV. Would be interested to know the way in which cultural change is being measured and evaluated within the organisation.
Look, it is early days, and I know that there was a fair bit of work done prior to the Reformation. I think that the culture's on a steady incline now because of COVID. Who would have thought that it would be difficult to actually reform a service like the fire services in Victoria through a pandemic? But it has had its pitfalls for sure. So we still have people who haven't met each other in directorates in the organisation, who have been working remotely and haven't actually been in the same room as some of their colleagues. I think the culture, the actual workplace culture stuff, as under the Fire Rescue Victoria banner, is starting now, because we have people gravitating back to work. I mean, we've had 4 hiccups now in the form of lockdowns, and our workforce, the same as the wider community and other workforces, are quite triggered by that as well. So I think the work that is going to happen hopefully will happen once normality comes back into the workplace. I know that operationally we've done really well, and that our firefighters are out there doing what they do ordinarily, because that's what we do. I mean, we don't compromise on the service that we deliver in an operational capacity. Our corporate staff and operational people that are in day work roles like myself, our move into becoming familiar with the new culture has been a bit of a slower journey.
And one last question here. Someone says, thanks, Steve. Can you talk about the vulnerable people's list? If we're talking about fire safety, say for instance, there's a couple of things that we can do within the organisation that is within our operational capacity and our standard operating procedures. And one of our groups of vulnerable people in the organisation are the hoarding people. So people in community who hoard, basically, and that isn't specifically about the elderly, but quite often the elderly are the ones that are hoarding. So that's a vulnerable group that we have now have some research that's been done on it, and we have an enhanced response to that particularly vulnerable subset of people within the community. So an enhanced response means that through our partnerships with local government and home and community care, say for instance, DHHS, we have information that can alert our responding that it may be a premises that has a hoarding issue. So that's one example, and I would argue that we could also have greater awareness about in the Marram scenario, where information is shared about domestic violence survivors and victims, where we may be able to share information that we become privy to with police to be referred on to service providers as well for women who are going through a domestic situation. Thank you. So now we've almost come to the end of today's forum, but before we do go, we have one final segment, and we're going to discuss where to from here. And I'd like to call upon Liam, Kate, Steve, Deb and Beth to join me again for this Q&A. So thank you all for coming back. So what have we learnt from this global pandemic so it doesn't happen again? Liam, I know you're eager to answer this.
I am really. They're such incredibly broad questions. I want to go to 2 things that perhaps weren't apparent from the presentation. One is empathy, which I talked about. In the training that Steve talked about, that the GABPOD does, we look in a fairly gross way, but at the gender divisions between female leaders and their response to COVID, and people like Bolsonaro and Trump at the time. And a number of women, Jacinda Ardern being typical, talked about the need for both empathy and strength, that these are not oppositional, these things exist, and good leadership, particularly under disaster conditions, but generally involves a marriage of those two. And I do think that COVID-19, to some degree, at an experiential level, not structurally, flattened the playing field, so that groups that really had seen themselves as radically different, there was something common to our experiences under lockdown. And if you live in Melbourne or Victoria, I think you have that pretty much more deeply perhaps than other areas. So I want to say that it opens up possibility for that, and a reconsideration of a whole set of things around empathy, which I don't think you can apply an intersectional lens without an empathetic understanding of difference as well. Very rarely talked about in intersectional literature, which talks about structural inequality. And but I do think if you don't have some embodied understanding of the experience of people who are different to you, it's not saying you understand, but you have some understanding through your own experience, I think we end up endlessly in disaster situations of these polarisation of stereotypes and overvaluation of all those things that are damaging, control, all the things we associate under a current regime with a highly masculine gender. So that's one thing. The second, which we've talked about a bit, and I know Suzette at Respect Victoria and I, in a link up, we're talking about the limitations of models of resilience. The idea that, and I'm going to take it to an extreme, but this is my view, and please, it's not a view of anyone else on the screen, organisations, is that if you push that to the extreme, we just overvalue suffering. The idea that, you redeem suffering makes sense up to one point. I see it as a Catholic narrative, being an ex-Catholic, redemption, but really you shouldn't suffer in the first place. So the idea that you build up resilience has its own limits. And I think Suzette said it very well in one of the meetings, that when you've been through 3 or 4 lockdowns, it's not a question of resilience necessarily, it can be a question of trauma. The second lockdown triggers trauma, the third re-triggers, the fourth re-triggers. For queer people, it takes you back into a history of where you've been seen as really under disaster conditions. And that's the limitation of resilience, because the idea that you just transcend that, you learn from it, and as an individual you get better, doesn't address the question of why in the first place particular minority groups have to build up resilience in the first place. So I think there's real limitations, and I think COVID is another opportunity to revisit those. So they're two things that come to my mind that are floating above, if you like, the presentations today, and that's empathy and resilience, and what we learn about those two through COVID and how they figure under disaster conditions.
Deborah, would you like to answer that question? What have we learnt from this global pandemic, and so it doesn't happen again?
Yeah, and I think I'm going to follow Liam and take a really big picture look at this, thinking that we can kind of drill down later. But, transformational change, which is, I think, what all of us here who are interested in these topics are really keen to see. Transformational change happens after things like the world wars, after Great Depression, global depressions, and after catastrophic disaster. And COVID is clearly a catastrophic disaster. Look at the way it's affected the economies around the world. So when Klaus Schwab said he's looking for a great reset, a new kind of capitalism, I think that's what we need to have. JobKeeper is one example of that. Let's look at ways of keeping support for everyone in our society and move away from, the individualism that we've seen creeping in since the 1980s. So in terms of white male privilege, that's another thing. That's sort of looking socially at who matters in our society. And we know it's white men essentially, and the rest of us in marginalised groups get the crumbs from that table. So I think if we, all of us, just be really alert, knowing that this is a window of opportunity for change. It could take us back to what we heard about women back in the home. It could be really bad for LGBTI people, for older people. Let's look at ways to change society so it's going to not only minimise violence, but actually give people a better chance, a better go in our society.
Would anyone else like to answer that question? What have we learnt from this global pandemic? Beth, maybe?
Yeah, sure. I think someone said to me quite early on in the pandemic, it was one of my colleagues' grandmothers, she said, we might all be in the same storm, but we're not in the same boat. And I think that's something that's really resonated with me. And I think it's something that we need to think about and look at. And when we're looking at intersectional frameworks, often we talk about intersectionality, it's bandied about, and often cohorts are kind of added on. Actually, intersectionality is looking at people holistically and their multiple experiences. There are people who have multiple compounding forms of discrimination that they experience in their everyday life. Their experiences of the pandemic are going to be quite different from other people. So I think it's looking at the need to actually address intersectionality, use intersectionality in our frameworks, and develop better responses for people who need a bit of rafting on their boats to keep them going.
Kate, would you like to add anything there?
Yeah, probably just to echo everyone, really. Something that kept coming up in this work for us was that a lot of the work done in disaster space is reactive rather than focused on prevention. So I think the most important thing is to continue to address systemic drivers of family violence, and for elder abuse, it's things like ageism, but also gender inequality and homophobia, transphobia, racism, all those intersecting forms of inequality. I think it's no, coincidence that we saw those groups disproportionately affected by the pandemic. A lot of us have spoken about the gendered impacts, for example, and that just replicates existing inequalities in our society. So unless we address those in the first place, this situation will repeat. But yeah, Deb mentioned capitalism, and actually older people spoke about things like capitalism and neoliberalism in our work, and particularly how it affected them when they retired, that they felt like they were no longer meaningful citizens when they couldn't contribute economically or in an employment role. So I think we need to address how older people feel in that stage in their lives. Many of them said, I can volunteer, but people will only let me stuff envelopes. They need meaningful opportunities for involvement, even in these conversations around planning and mitigation. And those, providing meaningful opportunities for engagement. I spoke about how we piloted an intergenerational program, and that shores up a protective factor in social connection. And we've seen promise, at least, that can both reduce a driver of elder abuse in ageism, but also, be a protective factor in terms of social connection. So I think, we need to focus attention there.
Steve, would you like to add anything?
Thanks, Carla. Look, only that I think emergency response orientated organisations like ours will be spending more time in the recovery phase, because we know the recovery is it's long lasting. I mean, the people that went through Black Summer are still yet really to feel any sort of recovery, because they went straight into a pandemic and we're still in a pandemic. So recovery ordinarily outside of the pandemic is long lasting. So it's complicated, it's complex, and the responders just can't go in and say, job fixed, we'll see you next time there's an issue. Try to stay resilient if you can. I think we need to stay with them longer, with the communities longer, to ensure that in recovery, which is where a lot of mental health issues are going to, kick in, we need to be there along the way just to support.
And also this question is probably relevant to you as well, that how do you think we need to prepare before and between disasters so that, family violence is prevented during and after disasters?
It's interesting because I know that the loudest voice at the moment are former leaders of the fire services. So former chiefs are talking about climate change and that direct impact that climate change is having on the ferocity of storms, that create floods that we have, on the fires that we have as well. So I think the discourse has to start with leadership groups that are still within the organisations to start talking about what the causes of these disasters are as well, including a pandemic. But as far as the family violence side of it goes, look, I'm not 100% sure what we can do except start a discourse. But once again, referring back to what Beth said before, it is complicated. Prevention is a complicated beast.
Yeah, if I can add to that too, I think the provision of basic services is essential for resilience. You hear it all the time about people need to be resilient. You can't be resilient if you, like the people in East Gippsland and here in Trentham, if you don't have power, you don't have water, you don't have a connection to the NBN or to the internet. So you need to have those things provided at a government level and provided quickly, without those kind of political agendas that sometimes get in the way of that quick provision. All of that relates directly to prevention of violence. We know that from other disasters. So I think there's that. The other recommendations I would say is, like beforehand, to work out ways of gathering data. The thing about what can be counted comes to count. So we need to have the data about how all the marginalised groups are coping within disasters, to know that we need to do something different and to understand that emergency services aren't treating everyone equally when they treat everyone the same.
Would anyone else like to answer that one? How do you think we need to prepare before and between disasters so that family violence is prevented during and after disasters? No. Yeah, we just about run out of time actually. So just, I guess, one final sort of question, you know, given all this research, how can we take this forward? Kate, would you like to answer that one?
Why me? I think Deb made a good point. Like, for example, when I dug into those family violence statistics and the increases that had happened during COVID, a lot of that data wasn't even age disaggregated in a meaningful way. I mean, I was able to get over 55, for example, but the surveys that were done were just all women over 18. So, you know, really building in that attention to marginalised groups at the initial data gathering phase proves very useful, because Deb's right, once you've got quantitative data to show that this is a problem, people start to pay attention, but we're not even gathering it in many cases. So yeah, I think that's a good place to start.
Would anyone else like to respond to that? How to take this forward, given what we've learned from the research?
I'd probably just put in a bit of a plug for our gender and emergency management GEM guidelines. I think they're really practical, and it's a checklist, so even emergency managers who are really feeling pressured by a disaster can pull it off the shelf, and it's got check boxes, but it's really grounded in deep research and literature reviews. I'd also say about training, that cross-pollination that we talked about between the prevention of family violence sector and emergency management sector, and of course including diverse groups, you know, around the table when we're looking at every stage of disaster.
Okay, well, we have run out of time, so I'd like to thank you all again, Liam, Kate, Steve, Deb and Beth, and thank you very much for joining us.
Thank you.
Thanks.
Thank you. So we'll now need to start wrapping it up, but before we do go, I'd like to introduce Cecilia Hamana, Respect Victoria's Director of Research and Evaluation. Cecilia has over 20 years experience conducting research and evaluations on complex social issues and challenges in both Australia and New Zealand, spanning multiple industries and sectors. She also has a depth of experience consulting with culturally and linguistically diverse Aboriginal and Torres Strait Islander youth and older people and regional and remote communities. Over to you, Cecilia. Welcome.
Thanks, Carla. Even though this is a closing, I would also just like to acknowledge the traditional owners and custodians of the lands upon which we were all meeting from, and for myself, that is the Wurundjeri people of the Kulin Nation, and to pay my respects to elders past, present and emerging. Can I just check, Carla, can you hear me okay? My tech has been playing up a little.
Your audio is a bit low, so maybe you might like to pump it up a little bit.
I can certainly try.
Yeah, that's sounding a lot better. Thank you.
Okay, fabulous.
Excellent.
Firstly, Carla, to you, kia ora, and thank you for being an amazing facilitator for us today. And also I'd just like to thank all of our researchers and speakers, presenters today. Liam, Leonard, Beth McCain, Kate O'Halloran, Deborah Parkinson and Steve O'Malley. We've been really pleased to be able to continue our partnership with the Gender and Disaster Pod and the Women's Health in the North in presenting the first of Respect Victoria's ongoing research seminar series. We'd also like to thank in presenting the studies as well, the National Ageing Research Institute and the Centre for Family Research and Evaluation at Drummond Street Services on the research itself. A shout out to our Auslan interpreters as well. You've done an amazing job keeping up with the speed of the speakers. And also finally to Leanne Wilson, event manager from Happenings Australia, for running such a smooth event for us. I'd also like to thank especially all of the participants who have taken part in the first of Respect Victoria's online research seminar series, which will become one of our flagships in providing and sharing research and evidence to the primary prevention sector. And it's been absolutely amazing to see such a large group of people attending from such a diverse range of sectors, not only from the primary prevention and family violence sector, but also those from the disaster and emergency sectors and everything else in between. I think from the research that we've shared today and have shared via our respective websites, the reports and so on, there's a lot of gaps in research and continuation to build on the research that's already been shared today. One of the things that Respect Victoria will be doing over the coming months, and this is potentially where we might be able to look at how we can continue the amazing work that's been presented here and grow that evidence base, is the development of a research agenda for primary prevention in Victoria. So that's something that we will be looking at and no doubt engaging with many of the people around the screen today who shared the research findings. As you would have heard today, these research reports have detailed the experiences of particular cohorts or marginalised groups here in Victoria and the impact that COVID-19 has had on them. It's been particularly interesting to see how the implications of living under a pandemic aligns with various risk factors for family violence, particularly as they relate to older Victorians and those from the LGBTIQ+ community. This really does heighten the need for the prevention sector to be vigilant to the needs of these specific subgroups of Victorians who live with multiple forms of discrimination. And we've heard about the intersectionality and the multiple layers of discrimination that many of our marginalised groups face. And what we have seen and learnt from the voices of those presented in the research shared with you today provides us with extremely useful information that will continue to inform our work for hopefully not too many more resurgences of COVID-19. I'm sure, like myself, like for many of you, we are all over COVID-19, but nonetheless, it still stays with us and will be with us for days and weeks and months ahead, and potentially other pandemics and indeed other forms of disasters, as Steve has outlined. Now, the importance of maintaining and growing linkages between the prevention of family violence and violence against women sectors, and with that of the emergency sector and the disaster sector, is really critical going forward. And I think today represents a small step in that collaboration, but there is still a lot of work to be done in ensuring that we can keep connected, we can keep creating those linkages and supporting those connections so that our sectors can work in unison to meet the needs of all Victorians. Today, we've also seen the impact on the work and lives of our prevention sector staff themselves. And other studies have also looked at the impact of COVID-19 on the response sector staff. And we need to be cognizant not only of the specific needs of these staff, but also, and many of those today have spoken about the creep moving between prevention and response, particularly in times of crisis and disaster. But we certainly need to keep ensuring that there is an increased focus and funding for prevention for all of Victorians. We often know that the funding often goes to the squeakiest wheel, which is always in the response space. This is no different for family violence or violence against women. We see it in the health sectors, where it's the old adage of the ambulance at the bottom of the cliff versus building the fence at the top of the cliff. Just to share with you as well, the UN Women in the publication of COVID-19 and Ending Violence Against Women and Girls 2020 cited 5 recommendations to address the increase of violence against women during COVID-19 through accelerated and concerted efforts of governments, international and national civil society organisations and UN agencies. This is the allocation of additional resources to include evidence-based measures to address violence against women and girls in COVID-19 national response plans, strengthening services for women who experience violence during COVID-19, building capacity of key services to prevent and improve the quality of the responses, and ensuring the sex disaggregated data is collected to understand the impact of COVID-19 on violence against women and girls and inform the response. Now, Respect Victoria agrees with these recommendations, and undoubtedly you would have heard today that they also align with today's research findings. We also need to be cognizant of the additional need to focus on women in all of their diversity and family members, other family members at heightened risk of violence due to the intersecting forms of discrimination. As our CEO, Amy Prendergast, mentioned at the opening of this forum, Respect Victoria has developed an intersectionality framework, which is why we chose to focus on two particular subgroups of Victorians in the studies today. These were the LGBTIQ+ community and older Victorians. And the sessions today have indicated when these individuals experience multiple forms of discrimination, their risk of violence is heightened and it's also different. This is why prevention work really needs to identify the different drivers for violence in the areas of LGBTIQ+ family violence and elder abuse, in addition to other forms of family violence and violence against women. Because of our focus on this, just share with you, Respect Victoria is going to be conducting a couple of significant pieces of research, has already conducted some significant pieces of research looking at primary prevention of elder abuse, and this is with NARI, who have already, the National Ageing Research Institute, and primary prevention of violence against women with a disability with the University of Melbourne, and we look forward to sharing those results with you. We are also undertaking this year two major pieces of research in the Aboriginal Victorian communities, looking at primary prevention specifically, and we look forward to also sharing the findings from that. We're also very pleased to announce that the second of our online research seminar series will be conducted later in July, on the 22nd of July. And this is work where Respect Victoria has partnered with the Centre for Family Research and Evaluation at Drummond Street Services on the prevention of family violence for the LGBTIQ community in their transition to parenthood. And as we understand it, this is quite a groundbreaking piece of research which focuses on that kind of critical point of transition into parenthood for that cohort. We look forward to keeping you updated on the release of on the upcoming research. We are really delighted that you could join us today for an online seminar series. We invite you to complete the survey at the end, and I believe Carla's going to also encourage you to do that. We really are looking forward to your feedback to help us make these online seminars and our seminar series as valuable as possible to you. It's been a real honour to be able to hold this session in conjunction with our research partners and with you, Carla, at the helm, keeping us on time and on track. And also just to let you know that we will be able to share with you the information from today, the details from the chats and the questions and so forth, and really look forward to continuing this journey with you to preventing violence before it starts, which is, if you recall, is the core tagline to these research seminars. Thank you.
Great. Thank you so much for those closing remarks, Cecilia. Lovely to meet you online. I hope to see you in person one day. It's been an information jam-packed morning. I hope you've all enjoyed today's forum, and thanks to all our speakers and our audience for their participation. We'd also like to thank our partners, Respect Victoria, the Gender Justice and Disaster Pod, Women's Health in the North, Drummond Street, NARI, and the Centre for Family Research and Evaluation. And hopefully you can see the websites for those organisations on your screen. So we ask that you please stay online. As Cecilia said, there is an online survey for you to complete, so please fill that out because we'd like to get your feedback on today's forum. It's been a great pleasure being your MC. Thanks very much for having me, and enjoy the rest of your day. Thank you.